In the front, in the lower part.
Front?
But
Why?
I have a immediate denture, so it's
Oh,
okay.
okay. Take care. Try to take soft foods, okay? Okay, and take Advil. Don't scared to take Advil or any painkiller, because you guys say, oh, Advil or something, but that helps you to reduce the inflammation. I'm not telling you to take Advil forever, but couple of days when you feel the pain or inflammation, it helps you to reduce the inflammation. Okay?
Thanks, Mom.
Okay.
Thank you.
Okay. Okay.
Only if you're not on blood thinner, right, Miss?
Blood thinner Advil doesn't do anything. There's the aspirin.
Oh, that's oh yeah, aspirin. Yeah, you're right. Sorry.
It's okay. It's
Yeah,
okay.
aspirin. Yeah.
Okay. So basically, let us start. I hope some of you, Asnet, you are in what is called, it's a clinical chemistry. But you got all my emails?
Good morning. Yes, ma'am. Got your emails.
I got your emails for the review.
Review, I sent couple of emails.
Oh, I got two.
3 emails probably.
No,
Right?
just
Right, you guys?
Yes.
2 or 3?
Yes,
3
ma'am.
emails.
I
Yes,
gotta
ma'am.
check.
3
So
emails. Yes,
yeah,
ma'am.
that is one for the review one or study one for your study. That is helpful for you guys with the
Yes, ma'am.
yellow highlighted all these things.
Yes,
That
ma'am.
one is helpful for you. And then I send you the review. Okay. And what I send another one. I don't know how I am sending one by one. So
Yeah, I got the review and the highlighted one. That's what I got.
did I send 2 or 3? I don't
It was
remember now.
I got two. Let me
About the
check.
ML power.
Yeah, there was one about the high mile power.
Mm-hmm.
Yeah, what about that one? Like, is
Oh,
it
that
for?
is not, that is the tell that even the ML Power exam is on that time. Until you complete your placement, you
Yeah.
cannot sit for the ML Power or apply for the ML Power. Because when you are going to, they said that in the ML Power exam, they are going to ask to place your certificate from the school during some time. It's written in the email. So even you are thinking that you are going to complete the class by July, but it's আমার আমার আজ রাতে কাজ নেই কটার সময় আমার ক্লাস আছে তোমার 1টা অবধি 1:30 অবধি তারপর কটার সময় আমি একা থাকলে হবে ওরা কাজ করে জাস্ট হোল্ড অন আ সেকেন্ড প্লিজ ওকে সরি yeah sorry some repair has to done in the alarm system now they told that they are going to come in the morning they are changing the time that's why it's okay thank you sorry for that yeah
So we received the reviews, the both of them, and the ML Power. That's what I received.
okay so one you got test yourself right and one
Yeah,
is the review for the study and
yeah.
another email which Rajiv has sent to me I have forwarded to you.
Mhm.
That is
So
the
the
mail from the Rajiv. It's not mine. That is from the came from the company director, and he told us to forward to you. So I did that.
yeah, okay.
Okay.
Yeah.
Okay.
So the
Good.
one, the unit 1 to 3 is a test yourself one, and then your review with the yellow highlight.
Mm-hmm.
Okay.
No review for your study to help you guys. I try to make all the gist and send you so that maybe helpful, maybe not. You guys can read it. I try to do that for you, so you guys can say what is useful or not. What you want to go for the D12 or you want to study. D12 is always better, but yeah, you can just that's a very short review so that you guys can get the gist or summary or press it from there.
Appreciate it, Miss. Thank you.
Okay,
Yes, thank you,
See if
ma'am.
I can get caught up now.
I know. Just give me a second. Kindly check whatever I did the Bhera. This is the clinical chemistry review, test your knowledge, and email power. Yeah, that's the three emails I send it to guys. Yeah, okay. Yesterday. Okay. Mhm. So, okay. So that one is this one. Okay. Let me share, and share, and this one. So today, as you guys learning about the different details about the what type of test panels, what type of instrument is using, what I mostly discussed yesterday. So we are going to go a little bit more ahead about the electrolytes. What are the major electrolytes in our body?
We have
Anyways,
sodium,
Sodium,
potassium,
potassium,
chloride, and
potassium,
bicarbonate.
chloride,
chloride and
Bicarbonate, ma'am.
bicarbonate. And can anyone say any name of any other electrolytes?
magnesium,
Yes.
Yes.
The zinc,
calcium, sodium, potassium,
zinc also.
Calcium is another one, very important. Yeah.
Yeah.
magnesium,
Magnesium, yes.
sodium, potassium,
That we already discussed. Those are the major one. Sodium,
Zinc and
potassium, bicarbonate,
manganese.
zinc. Those are you need very little, but you need zinc. You need phosphate for your bone. Phosphates, right?
Yes. Yes,
Phosphorus,
ma'am.
phosphorus for bone. So
Phosphorus. Yes,
yeah.
ma'am.
So these are the
Bicarbonates.
yeah. So these are called the electrolytes. Why is called electrolytes?
They assist in the conduction of electricity for your heart to pump.
Not only heart, it has carries the it can do the muscle also needs the function with the plus and minus. So they have the charge, either
Yes.
positive charge or negative charge.
Right.
And with the charge or differential of the charge, they help in the different processes in the body. Okay, just hold on a second.
The iron charge. Okay.
So in the PowerPoint today, I just try to highlight because I was going through the PowerPoint. It shows this too much information. So you like yesterday also, I just try to highlight which is really, really very important for you guys. So you can just take a note in your thing. So either these are also the minerals. The another name of electrolytes is the minerals. In general word or very less summary, sometimes people doesn't understand the electrolytes. If you tell somebody, so its another name is mineral. So minerals are also termed as the electrolytes. So what they does, they carry an electric charge. You have to like everything homeostasis is the body is very important. So balance of electrolytes in your body needs to be maintained because they affect the amount of water, your blood pH, your muscle action, your heart action, your brain action or nervous system action. Everything is very important about the balancing and do the balancing the all the processes. ECG, you said polarization, depolarization, muscle activity, how the is going to move, positive ion, negative ion, everything, blood pH. You know the pH is hydrogen ion concentration. Calcium is important for your cardiac. Sodium, potassium is very important for everything. So that is you need to be always maintain, try to be maintain the homeostasis. Body itself does homeostasis to do the maintenance of the balance of the all the electrolytes. When there is an impairment or any problem in the any processes in the body, then the homeostasis is broken down. Sometimes the sodium is high, blood pressure. Sometimes the potassium is low. So those are the different physiological manifestations which may cause some health problem. Electrolytes in the blood can exist in acid, base, salt, anything like sodium chloride, sodium bicarbonate. When is the bicarbonate is little bit acidic. Potassium, when is chlorine. So positive and negative. What is the how much is positive pH? When is the acidity? How much hydrogen ion and how much hydroxyl ion is present. So electrolytes, those are the substance we already told it exists in ions or charged particles when they are dissolved in water. If you put the sodium chloride outside as a salt, it has the positive and negative binding between sodium and chlorine to make a sodium chloride. But that time it's neutral. If you touch it, if you use the any electric meter, there is no charge. Only when you are putting in the dissolving water or any fluid, is going to be mainly the water. It dissolves in the water and then they separate sodium and chlorine. Say for example, sodium chloride. That is one of the main constituent. So when electrolytes are in the liquid or in the water, they dissociate into the charge. Electrolytes either negatively charged called the anions. This we have learned when we did the basic chemistry. And positively charged are called cations. Okay, negative anions. Absence of charge is called absence of positive charge is anions, and positively charged are the cations. This remember these terminologies because you guys make a lot of confusion and what is the anions and cations. Sometimes you guys convert it. So sodium plus is going to be the anion or cation.
I think it's an ion, ma'am.
Ion. What is the cation or anion?
Oh, an ion is the positively charged ions, and cations are the negatively charged
No,
ions.
cations are the positively charged ions.
Oh, sorry.
Cations, that's why cations are the positively charged. Sodium, potassium, magnesium, zinc, these calcium, these are all positively charged ions which are cations. When is the negatively charged ion, these are called the anions like chloride, bicarbonate, phosphate. Okay, so these are the negatively charged. So electrolytes like the sodium, potassium, calcium, magnesium, these are we call the cations. Chloride, bicarbonate, phosphate, these are the negatively charged. These are called the anions. That's why I'm telling these mistakes happen so many times. You guys make the cations to anions, anions to cations. So always keep it, always positive is cation, negatively charged anion. So what are the common electrolytes? You already know the cheap positively charged electrolytes are sodium and potassium. They are the master electrolytes in our body. And the cheap negatively charged, they took most of the action, chloride and bicarbonate. These four are regulating major of the physiological process. So these assays for electrolytes can be done in the plasma or serum. Either you can collect it in the mean tube or you can collect it in the any SST tube. Either is gold or red or for the stat or step tube, it doesn't matter. You can collect it in the serum or plasma. So electrolytes can be assessed both in plasma or serum. Concept is clear from this slide. So either you can, depending upon the auto analyzer, when you are going to work on the lab, so what the auto analyzer accept what type of tube you have to draw in that tube. But nowadays, recently, on the basic concept, you can choose either serum and plasma to do that electrolytes analysis. Say, for example, in your draw, there is no need of to draw the SST tube, but you need to draw something for the PST tube, which needs to be done only on the plasma. So for the electrolytes, you are not going to draw another SST tube, so that you can pull from one single sample and you can send it for the analysis for different things. That's why, so that you can take the minimum blood, draw minimum blood and use the maximum. Nowadays, the auto analyzer is working off that principle, but you can do either in serum or plasma. So who mainly controls over the electrolyte concentration? Kidneys and lungs are the organs that exert the most control over the electrolyte concentration. Kidney is the master one, and lungs also does something because they are taking out and inside of the air. So that time some reactions, changes happen. So when the body is unable to maintain normal control over acceptable concentration of electrolytes, either by excretion or conservation, and electrolyte imbalance occurs. So if there is a problem in the kidney function, the kidney will not be able to excrete or keep selective permeability kidney, right? How much sodium has to excrete, or how much chloride has to keep, or how much potassium. That is the kidney is taking care of that depending upon the what the normal level of the body should be. If there is excess sodium, kidney is going to excrete out. If there is low potassium, kidney is going to retain some potassium. It's not going to put it out. But when the kidney cannot function properly, kidney cannot understand what I should do. So there will be electrolyte imbalance. That is called the electrolyte imbalance. So here is a chart what tells you, let me see this one. If I can get a little bit bigger. Which arms helping responsible for helping which part? Sodium regulate fluid balance, aids in nerve and muscle function. Potassium and sodium has the same type of function because they works one against another one. If sodium comes in, potassium goes in. So that always try to make the balance. Potassium also helps regulate fluid balance and nerve and muscle function. Chloride, fluid balance, but chloride helps in the pH balance of the body. Calcium, essential for bones, teeth, and also it's in nerve and muscle function because it's need the calcium. So calcium, sodium, potassium, they are the helpful for the muscle and nerve both. Chloride mainly in the acid base balance. Chloride. Magnesium, muscle nerve function, helps in regulate blood sugar level. Phosphorus, healthy bones like the calcium, teeth, and also growth and repair. Bicarbonate, obviously there will be pH because it's going to form the acid. pH balance to buffer system, to buffering the pH. So when there is acid, some area is getting acidic, bicarbonate is going to take place to make it buffering, means making the keeping, try to help to make the pH of the required pH of that area. When the stomach or in the blood pH is probably 7.35 to 7.45. If there is a change, the bicarbonate is going to come in action to make it towards the normal blood pH range. sodium, discussed so many times, major cation, positively charged, and it present the, this is the question, that's why I highlighted it, highest concentration in extracellular fluid. These questions come, which cation or which ion or which electrolyte is present in the highest concentration in the extracellular fluid? Write note. So, sodium in general is a major cation. Cation means is positively charged, is an electrolyte, is a mineral, it has so many names, and it presents the highest concentration in the extracellular fluid. Important, a low osmotic pressure means blood pressure, helping the blood pressure ultimately, electrolyte balance, and ultimately you saw that one, it's helpful, it's needed for your muscle nerve action. Sodium is associated with levels of chloride and ions, therefore has a major role in maintaining the acid base, because sodium chloride, when there is a chloride, chloride is helping the acid base. So when there is a interchange between the sodium and chloride, not directly, but indirectly, it helps in the acid base balance of the body cells. What is the name of, this is the terminology, hyponatremia. Sodium, the original Greek name is natrum. So when there is a low sodium like the hyperglycemia, hyper, so it doesn't say hyposodiumia. So it's called the hyponatremia because the original, the good name of the sodium or the Greek name is natrum. And from the natrum is can Na, sodium. So low sodium levels called hyponatremia. High sodium levels is called hypernatremia. When you can observe the low sodium, polyuria means you are doing too much urination. When there is a metabolic acidosis, that means it's breaking down. And there are some other disease called the Addison disease. It causes the sodium to go out. And diarrhea. You have too much diarrhea means you are water loss. Your body water loss means you are losing all the electrolytes and ions. Diarrhea not only causes the sodium, is going to cause potassium, everything. And obviously some renal tubular diseases where the renal tubule cannot function properly and loses its selective permeability for the sodium or any that is going to disturb for any else, but we are talking about the sodium, so it cannot maintain the homeostasis. And high level of sodium is called hypernatremia. Any again, kidneys can conserve or excrete large concentration of sodium depending on the sodium concentration of the extracellular fluid and the blood volume, that is maintaining the homeostasis. So how the regulation of plasma sodium takes place? Regulation, you take intake of water in response to thirst. Excretion of water, peeing. How you are going to pee, the which hormone takes place, antidiuretic hormone, that you have learned in the endocrinology section. Regulation of blood volume, which affects sodium excretion to aldosterone, angiotensin, and arterial natriuretic peptide, ANP. So these are the things helps in regulation of the plasma sodium. Intake of water in response to thirst, excretion of water, regulation of blood volume through the hormonal action. What are the different sodium related conditions we can see? Clinical condition resulting in excess sodium include cardiac failure. Excess sodium called the congestive heart failure. It can also cause the liver disease, ascites, deposition of fluid, and renal diseases. An increase in sodium level also found in the Cushing syndrome, where there is the hyperactivity of the adrenal cortex and more hormones than normal are produced. So what happened? It eliminates more, it prevent to eliminate the required sodium to make the homeostasis. Some dehydration due to water loss, you are vomiting too much, or you are diarrhea, some kind of brain injury, the diabetic coma, some drug therapy can also cause the excess or increased level of sodium. Now are coming to the another important ion is the potassium. Here the potassium's good name is calcium. So that's why when there is a low or high, it's called the calcemia, hypocalcemia or hypercalcemia. It is also measured intercellular cation. So here, this is intracellular cation. Okay, sodium is measured extracellular. What extracellular means?
Outside the cell, ma'am.
Outside the cell. And intercellular means inside the cell. In general, potassium is always high concentration inside the cell and sodium is outside the cell. When there is a disruption, sodium and potassium go in and out, then there is a difference of charge and some types of activity occurs. Okay, so potassium is the major intracellular cation, but it is also found extracellularly because there will always getting balance, right? Going in and out, in and out. Potassium has important influence on the muscle activity of the heart. Hypocalcemia, abnormally low potassium levels. It can happen from prolonged diarrhea, vomiting, or from inadequate intake of dietary potassium. Name one of the food which has good potassium level.
Banana.
Banana.
Yeah.
Banana. Good, very good. So the problem is when there is a low in potassium, somehow kidney cannot stop excreting potassium. So potassium, kidney cannot sense the potassium. It can sense for the sodium, it can sense for the somehow, we don't know why. Even there is a potassium deficiency. That's why majority of the time potassium deficiency cause a huge problem and they have to come and you have to do the potassium infusion. So body has no effective mechanism to protect itself from excessive loss of potassium. So a regular daily intake of potassium is very essential. So as the low potassium level is called hypocalcemia, high level is called hypercalcemia. So if potassium is regulated by the kidney, if there is a kidney function problem, it cannot be able to excrete the potassium. Though it cannot sense how much I will keep, how much load, but it will excrete. But if the kidney function impaired, there will be chance or kidney disruption of kidney function or dysfunction can cause the elevated level of potassium, which is called hypercalcemia. So one important purpose of renal dialysis is the removal of accumulated potassium from the plasma. Because if the kidney cannot function at all, there is going to be huge elevated level of potassium. Which hormone regulates that you have learned? I am not repeating it. Which hormone influence the sodium potassium balance is the adrenal corticoid hormones, ADH. Sodium and potassium cellular relationship. Inside, potassium is high. Outside, sodium is high. But it's not like that outside there is no potassium, there is no sodium, but it's a low concentration. Because these are always going back and forth, back and forth, back and forth during the activity. If sodium comes in, potassium goes out immediately for some function, and then immediately they are restoring is their original or resting state. So inside, sodium is high, outside of the cell potassium is high, but there always will be little bit less. Okay. Sodium and potassium body fluids. Urinary sodium excretion varies, obviously with the dietary intake, mainly the water intake. For an individual's average diet containing 8 to 15 gram per day of sodium is typical. 18 to 15 gram per day. Oh, that's a lot. So diurnal variation. Diurnal variation means, what does that mean? Hmm? What is diurnal variation means? Nobody
Variation
knows.
in the time of the day.
Output,
Diurnal. Diurnal
Hmm?
yeah,
is
output
during the
of
day, daily,
urine
daily variation during the day. Because
Day,
nocturnal is night, so diurnal is day.
during
yeah. So day and night, we have two different phases. Diurnal variation exists in sodium excretion with reduced level at night. In night, generally, we doesn't have that much activity. Generally, we doesn't go too much for the urination until and unless some health problem or age. So after potassium is absorbed by the gastrointestinal tract, everything is coming from your food, right? It is rapidly distributed with most excreted by the kidneys. You have know about this one, how the maintenance of the, you have this one before. How it happens, glomerular, which is coming here, which is going out, glomerular filtration, then tubular filtration, what is going to the loop of Henle, then proximal distal tubule, distal distal, which ounce goes in and out. This you guys have learned before when we did the urinary system. So I'm not going to repeat this one. This is the chart, the diagram you have, so you guys can go through that one, where the water comes out, when the sodium is going out, which area, when the magnesium sodium is going in, reabsorption. So basically it's going to filtering out and in. Obviously, this is the glomerular part, this is the proximal convoluted tubule, this is the loop of Henle, this is the distal convoluted tubule, and this is the collecting duct which makes helps the urine. So this we already discussed, but just to again telling you factors that regulate distal tubular secretion of potassium, sodium potassium intake, water flow in the distal tubules, plasma level of mineralocorticoids, that's the hormones, and acid bed balance. Renal regulation of potassium excretion, it is influenced by renal tubular acidosis, if the renal tubule has more acid or base. Retention of potassium present in patient with chronic renal failure. Obviously, renal failure means kidney cannot excrete out the urine. So there will be more potassium in your blood. So these are the different values. You can accept the, where you can measure in except the serum and plasma, you can measure the sodium concentration is cerebrospinal fluid. Sodium and potassium. So CSF. So CSF, the sodium concentration, you have to remember what is happening. 138 to 150 millimole per liter. Sometimes they ask you the question. So you just make sure whether they're asking the serum level of sodium and potassium or the CSF level of sodium and potassium. In the question, read it which level they are asking, the serum or CSF, or they are giving different values. 138 to 150 millimeter per millimole per liter is the normal range for the CSF or for the serum on plasma. Same thing for the CSF value for potassium is 70% of the plasma value. So it depends upon the what is the plasma. Plasma values means plasma potassium value is 70%. So if you have 100, for example, 100 millimole per liter potassium, for example, the potassium, how much is going to be the in CSF? Is going to be the 70 millimole per liter. Now we are going to chloride. This is cation or anion?
Cation.
Anion.
Oh, it's an ions there.
Evelyn, you have a really big problem in cation versus anion.
Yes, I'm still. Yes, ma'am.
Be careful, okay?
Yeah,
Okay,
thank you.
okay. So chloride also found in serum, plasma, CSF, tissue fluid, and urine. The cheap and like the cheap extracellular cations of sodium and potassium, we already told they are repeating the same things. The cheap extracellular anions are chloride and bicarbonate. Extracellular anions are chloride and bicarbonate. And there is a reciprocal relationship with them. If one goes in, another goes, if one goes up, another goes down. The chloride ion is the most important anion of the extracellular body fluids body. So this is the very important one. The major anion that counterbalance the measure of cation sodium. So it balance positive, negative charge. Who balance between chloride? So one of the major cation is sodium. To balance the electricity, electrical charge, who comes in work with sodium is chloride. That means the sum of all cations equals the sum of all anions. Is that right? Because all are positively charged or negatively charged. Always your body has to be electroneutral, except the functioning time. So whatever anions we have in the body and whatever cations we have the body, whether it is a sodium or chloride or magnesium or phosphate or bicarbonate, total amount of cation equals to the total amount of anion. That means total positive charge versus total negative charge. It should be always balanced. In blood, state 2/3 of chloride is found in plasma and 1/3 in RBC. So mainly that means that is more in blood than inside the RBC. Chloride has an important role in two main functions of the body: osmotic pressure, which controls the distribution of water among the cells, plasma, and interstitial fluid. By the osmotic pressure, it helps in the giving the pressure, which pressure will allow the water to get in the different cells, in the plasma, and different interstitial fluids. And also, it helps maintaining electrical neutrality, like if there is more potassium or more sodium, it's always go there and try to counterbalance with its negative charge so that it become electrical neutral. It also plays an important role in the buffering action of the carbon dioxide. We know in the lung, we are getting carbon dioxide and oxygen exchange. So it's in the RBC because we are getting the oxygenated blood and deoxygenated blood through the RBC. And there it also helps in doing the help in maintaining the pH. It's called the buffering pH. This is called the chloride shift. You doesn't need to know that one, but just the when it helps in the buffering to maintain the acidity or alkalinity in the RBC or the plasma is called the chloride shift. There is nothing there. High serum, you can measure chloride either in serum and plasma. These values are seen in dehydration and conditions that cause decreased renal blood flow, such as congestive heart failure. So you can see the high plasma chloride value, especially when there is a problem in the any renal problem can show all the cations or anions, all the electrolytes, high or low. Now coming to bicarbonate, that is the one of the things is mainly help in the, this is the extracellular anion and chloride is the intracellular anion. So these two are so the sodium is the extracellular, potassium is the intercellular cation, chloride is the intracellular, major intracellular anion, and bicarbonate is the major extracellular anion. Extra and intra means which is more in outside the cell and inside the cells. As the blood perfuses, the lungs, carbon dioxide and water are formed. Ultimately, they form the bicarbonate to carbonic acid, which is as the pH, low pH, and they help in the changing of the buffering of the pH of the blood. Now, the another electrolyte is calcium, essential for myocardial contraction, one of the main. Decreased level of ionized calcium impairs cardiac function and produces irregular muscle spasm, tetany. So when there is a ionized calcium is decreased, there is impairment of the cardiac function and irregular muscle spasm is called the tetany. Which hormones mainly regulate? Calcium is another important factor for the bone, right? But three hormones. What are the hormones which mainly regulates the calcium? Parathyroid hormone, vitamin D, and calcitonin. It regulates serum calcium. For the calcium, preferred is serum. So among the all electrolytes we learned so far, calcium is preferred in the serum. It can be measured in the plasma if you send it immediately, but it preferred calcium in the serum. It is important that the serum specimen for ionized calcium remain uncapped until immediately before analysis. It's not actually, should not be uncapped. You cannot keep it uncapped. This is not biological safety, biological hazards. What they wrote here, that cannot be right. But because of loss of carbon dioxide produces an increase in pH and altered protein binding. So how are going to, when there is an order for ionized calcium, anyone knows how you are going to draw it? I told you. Anyone can remember?
I can only guess, ma'am. Should be in a closed system.
Everything is closed
The
system.
container, yeah. Will be
Because
the
we are
same.
drawing the blood from the blood to the tube is a closed system.
Yeah, that's true.
Anyone has any remembrance, any idea, anything? No? You cannot put the tourniquet. You have to draw the blood without putting a tourniquet, because tourniquet is going to make the pressure and is going to be the accumulation. When you are pressuring the muscles, it can accumulate more calcium, ionized calcium. So when there is an order for the ionized calcium, you can palpate the vein, you can see the vein, you can do everything, check everything, but at the end, you are not putting any tourniquet to collect the blood. If you are collecting a series of blood where there is an order for calcium, ionized calcium, either you can poke the patient for the second time without the tourniquet for the ionized calcium, or if you have say 5 tubes to draw, you put the tourniquet. When the first tube is flowing good, you take out the tourniquet and then you collect the 4 tubes. This is the because in the hospital or something, or you cannot poke the patient 2 times. So you are collecting 4 or 5 tubes. Then you are going to collect the last tube, which is ionized calcium. I know it's a gold tube, it should go before, but you cannot do that. Otherwise, you have to poke the patient or you have to collect. But that time you have to be very careful that you are collecting the sample in such a way that no anticoagulant is touching anything in the needle. So it says uncapped until immediately before analysis, but as a rule, you cannot keep any sample uncapped. You cannot send any sample in the transport in the lab without uncapped. This is the biohazard. This is the wrong information I'm going to write to them. You cannot keep them uncapped. But the major thing is you cannot put the tourniquet to collect the ionized calcium. Okay? Keep it in note. That needs to be in your practical work, in the practical profession. It's very important for you guys to know. Okay? So generally, if you are working in the hospital, you are getting a lot of orders for the ionized calcium. Magnesium, the fourth most abundant cation in the body and second most abundant intracellular ion. This is important for normal bone structure in the body and also helps something in the heart function. High concentration of magnesium are found in the bones and muscles. It is less than 1% is present in serum and erythrocytes. So generally magnesium you can feel very small amount in the serum and blood, erythrocytes in the blood. What is osmolality? Osmolality is the number of dissolved particles in a solution, whether it's a sodium, potassium, calcium, magnesium, zinc, whatever. Number, how many different types of particles are dissolved in a solution. That is called the osmolality. The serum osmolality means what? A measure of number of dissolved particles per unit of water in serum. So number of dissolved particles in the serum, whatever you are getting, you are getting magnesium, sodium, calcium, potassium, chloride, bicarbonate, whatever, zinc, whatever, the different types of particles which are dissolved in the serum. That is called the serum osmolality. There are two different things, osmolarity and osmolality. Osmolality is number of dissolved particles per unit. Osmolality test significance when a low serum osmolality means higher than usual amount of water in relation to amount of particles dissolved in. Low serum osmolality means less amount of dissolved particles, right? Because osmolality means number of dissolved particles in the serum. So that means when there's a low concentration, the number of dissolved particles are less, water content will be more. That is called low serum osmolality, means higher than wow, higher than usual amount of water. So water is more in relation to dissolved particles in it. It's called the edema. So serum osmolality reflects the status of hydration of the intercellular as well as the extracellular compartments, and thus describes the total body hydration. So if the hydration, all constituents is going to be in the equal amount, or you can be saying if there is a dehydration or overhydration, so it's going to be edema, or you are hydrated or non-hydrated is going to show you from the serum osmolality value. The normal value of serum osmolality is 200 to 300. And remember, this is going to come in question. The unit, they are going to different units per kg of water of your body. 280 to 300 MOSM per kg of water. This is going to come in question. They are going to tell you, and they are going to different type of units here. Osmolality. So you have to remember osmolality means MOSM per kg water. It's not per liter, it's not per millimole, it's not for anything other units, millimeter, gram, anything. This is going to be the unit. You may get this type of question. Whatever I was going through, I saw this type of question. So urine osmolality is also accurate measure urine concentration than specific gravity. So what are the constituents or particles are dissolved in the urine? But the urine is more thick means you are dehydrated. Urine is more light means you are too much, you have too much water content. So nowadays you have the called the osmometer. This analyzer can measure the osmolality of many solutions, including serum, urine, plasma, biologics. Uses a method called freezing point depression. I never use this machine, so I don't know because we are everything done in the autoanalyzer. So this is called the osmometer. And this is an analyzer. They use the principles of freezing point. Freezing means obviously it's going to freeze the sample somewhere and then they are going to measure it. Okay. So in the difference between the calculus, but the pressure and elevation and the gap is who doesn't need this one. So only this one is important, that when you have the more elevated level of osmolality means patient is dehydrated. That means you are seeing more amount of different um, constituents. And when there is a less, that means osmolality is less. That means patient is retaining water in the body. So anion gap. To be honest with you, these are not going to be measured by anything. You are going to collect the sample, give it to the lab, and auto analyzer does everything nowadays. So anion gap. What is the anion gap? It's the calculation used to identify errors in the measurement of electrolytes, detect proteins, and evaluate the suspected acid-base disorder. So anion gap is helpful in measuring the acid-base disorder. That is the main important here. Why you do the anion gap study? The anion gap study is going to be done by to check the acid base disorder. So how you are going to measure it? You are going to get the question and make sure there are two formulas. I'm going to tell you in the next slides. What the questions this app they are going to, this you will never do in your practical practice. but you have to learn here in theory and you have to give the exam. So measure the difference between the negatively charged chloride and bicarbonate and the positive charge anion gaps. Anion means negative charge, right? And positively charged sodium and potassium electrolytes in your blood. Values is to derive from the serum plasma analyte testing. If the anion gap is too high, means more acidic. That means anion gap is more high means your blood is more acidic. If it is too means more not acidic enough, or is this mainly towards the alkaline side. The pH of the healthy blood is 7.35 to 7.45. So if you see the pH, if you do the anion gap study and if you see the value is 7.25, that means blood is getting more acidic. If you see the anion gap calculation, that means here you have more anions than cations. That is not going to the homeostasis, is not making the equal amount of positive and negative ions. And whereas if here are cations or the positive charge are more as per calculation, then blood is going to be more alkaline, alkalosis of the body, acidosis, alkalosis. So how you are going to calculate? There are two formulas. They ask, this is the question. You may come ask any question, read the question first. How they are doing, asking you to do the calculation. Using the potassium or not using the potassium. They are going to give you the value, sodium, potassium, chloride and bicarbonate. Then they are going to ask you calculate the anion gap using potassium or using non-potassium. If they doesn't say anything, calculate the anion gap, you can use any formula. But if they ask use the potassium, then you have to formula these formula. Anion gap is equal to, in your review probably I give you one of the example using the potassium, but this is the another one you have to remember. If in case they ask for without potassium, so here I put without potassium. So anion gap using potassium, how you are going to do that? You have to add sodium and potassium. Those are the two positively charged or cation. Then you are going to subtract from the total of the negative cations, the chloride and bicarbonate. The reference is 10 to this one, reference range. But when you are doing this one without potassium, what you have to do? You have to subtract from sodium. That is the only cation here. The negative minus the total amount of negative ions, that's the chloride and bicarbonate. When you are doing is the without potassium, and the range is 5 to 15 millimole per liter. So that's why can do the calculation with or without potassium. Okay. So remember that one. How the question will come, you have to see the anion gap calculation with potassium, without potassium. If there is nothing written with or without potassium, you can use any formula. But if that is specifically, they will tell you with potassium, you have to use this formula because that is a potassium. So you have to add both positive ions or the cations to subtract from the negative ions. And without potassium, you doesn't have the potassium. So you have to only use the sodium as your source of positive charge ions or the cations. Special considerations of specimen plasma can be assayed for electrolyte concentration when collected with lithium heparin green top tube. Because mainly the sodium, you cannot use it, the sodium heparin. You can done on the serum and capillary specimen. Centrifugation should be done within 2 hours of collection. This all you know. Centrifugation should be done within 2 hours of the collection. You have to keep the serum sample in the gold tube minimum for 30 minutes. For the red tube without any what is called clot activator, 1 hour. And for the orange top tube, it can be immediate between 5 to 10 minutes or maybe earlier. For the plasma, you can separate at any time, but it's preferable you can sit between 5 to 15 minutes. And then it has to separate from the RBC promptly if gel tube is used and testing is delayed. And then you have to transfer the alcohol after you centrifuge. You have to within 2 hours you have to centrifuge. If not, you have to put it in the refrigerator. And then after that, you have to immediately transfer the sample, plasma or serum in the and allocate it and use it within 2 hours, or you have to keep it refrigerated at the temperature between 2 to 6 degree. Sodium, lithium heparinized plasma serum, not sodium. You can use serum, urine and other body fluids suitable for the specimen. You can measure the sodium from the plasma, from the serum, from the urine and all other body fluids. Like I told you, you can do the CSF and other things. Transport and storage 2 to 8 degrees centigrade. Grossly hemolyzed and grossly lipemic specimens are unacceptable for analysis. Sodium can be measured in 24-hour urine specimens and CSF as per the following SOP how you are going to preserve it. Potassium, it's not like you are going to collect the sodium in the morning of the urine and keep it in the outside for a long time. They will give you the guidelines when you have to do the test. Potassium, plasma heparin anticoagulant for plasma specimen. Anticoagulant containing potassium cannot be used. Potassium oxalate, can you take the gray tube for potassium measurement? It can separate in the plasma. Can you take the gray tube for the potassium measurement?
No, ma'am.
Because it has the potassium oxalate as an anticoagulant,
Yes.
right? So it can
Yes,
give you
ma'am.
the false result. So it's called the heparin anticoagulant, whether it's the lithium, that's why I didn't mention lithium or sodium heparin. You can use any heparin because it's not it's a potassium. For plasma specimen, so be careful, anything, anytime. For the sodium one, you have to use the lithium heparinized plasma. For the potassium, you can use any heparinized plasma. Whether it's a lithium or for the sodium, it doesn't matter. But you are not collecting for different samples in different tubes, right? So in general, we use the lithium heparin as the main tube. SST or serum can be collected for testing, transport and storage in the refrigerator. Grossly hemolyzed and lipemic samples is going to be rejected for doing the sodium and potassium things. Following technical errors can contribute to the elevated potassium. Recentrifugation of the specimen in the gel tubes. If you find any clot, fibrin clot, it didn't separate properly, you are not going to recentrifuge. What we had learned, you have to transfer the serum or the blood in another tube and then you are going to centrifuge it. Inadequate centrifugation, that means all the blood cells, the clotted cells or the blood cells didn't fall down properly. Centrifuging blood tubes with stopper removed. Oh my God, it cannot do the stopper removed. It's going to vibrate and it's going to hemolyze. Pouring blood from one tube to another. So what you are going to do, oh, I have a little bit this, I am going to collect it. You are not going to pour one tube to another tube. So you have to collect it. Delayed centrifugation. You didn't do the centrifugation within 30 minutes or within 2 hours. Refrigerated specimen before potassium analysis. Improper vein puncture technique. Where there is a vibration when you are taking it, it can be hemolyzed. IV fluid contamination when you are drawing a blood from the IV. Chloride. What is the anticoagulant used most frequently for chloride is lithium or sodium heparin. It doesn't matter whether it's sodium or lithium heparin. It's a chloride. Serum separated gel tubes are also often used to specimen. Serum can be used for the collection. So either you can use the plasma or serum. Bicarbonate can be used with the serum and plasma. either in the mean tube or in the SST tube. Methods of quantitative, what is called, we know electrolyte profile. What is the main four electrolytes comes on the electrolyte profile? Sodium, potassium, chloride, bicarbonate. This has to be, when they see the electrolyte profile, it has to be measured sodium, potassium, chloride, and bicarbonate. These are the major electrolytes in the body for every function. It's called the electrolyte profile. You have learned before yesterday what are the different electrodes they can use. It's called the ion selective electrode or ISC electrode for potentiometry for testing method. Everything has been done in the auto analyzer, but you have to know that this is the, we told, right? You can use the measure for the calcium electrode, you can use the, but you have to use the different types, individual electrodes for individual ion testing or electrolytes testing. Chloride can also use the ISC method using the chloride or silver chloride probe or the electrode. Bicarbonate determines that total carbon dioxide is automated assay. You can collect it in the lithium or in the serum tube. Magnesium, useful in the cardiovascular, metabolic, neuromuscular disorder. Serum levels are useful in determining acute changes in the ion, but you can take in the plasma also. These are the different normal values. Reference range, critical low, critical high values. So you have to remember the values, reference range. If you remember the reference range, then they can give you any value. You can tell which is the high value or no value, especially for the sodium, potassium, and chloride. This is very important for you to remember, because anytime the questions is come, what is the reference range? Whether the unit millimole per liter in SI units, and what may be the critical value, low or high value. So sodium, potassium, chloride, please try to keep it in your mind. Okay. This is this one. I think we are done with the unit 2. Christiana, did you came?
Yes, Miss. Sorry, I was late.
Okay.
I'm here.
Okay. This one is done. Okay. Okay. So let me go to the other one. Unit 2 dot unit 3. Yeah, to the unit 3. So you want to start the unit 3, or you want to go for a break and then you want to do the unit 3?
Ma'am, let's go for a break. Thank you.
Okay.
We're back at 11:07.
Yes, ma'am.
Thank you, Miss.
Hello? 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 Yes?
Hello.
Yes? Hello? Okay, let us move on to the next unit. I hope everyone is here now. Okay, so good. Binas Yusra Santiago para come on to video.
I'm here.
Okay. Yusra Santiago till waiting. I know they are here, but just okay. Okay, so this is let us go to the cardiac one. Okay, so now we are going to the move to the, we did the electrolytes, we did the glucose metabolism, we did learn lot. Now we have to do the more our heart. So mainly you can get all the information regarding heart related problem, cardiac disease under the Heart and Stroke Foundation, who are concerned about the risks of cardiac diseases. And if you go to the Heart and Stroke Foundation page, if you like to know more details about anything, different types of heart disease, how to prevent it, how it can be diagnosed, you can go there and type the types of heart disease and you can get all the information. So who are in the risk of more heart disease? The patient which at the pre-existing conditions like as such diabetes has the high risk of heart disease because they have problem in their cholesterol level. Some acute phase of reactants and the cholesterol is also a very important indicator and controller of the heart disease, which can put you in the risk of cardiac problem, which is the LDL, HDL. So it's called the low density lipoprotein, which is a bad cholesterol, and HDL is a good cholesterol. So why you are telling why is a risk? Because it's always a ratio between LDL and HDL. And there is another called CRP, C-reactive protein. It can be increased in any inflammation of the body, including the heart. So if there is an inflammation of the heart muscle, any infection or anything, so it's going to become in the, so C-reactive protein is also another important marker. So which can, if there is too much CRP, it may be coming inflammation, it can cause the cardiac risk. What are the different terminologies we use related to the cardiovascular disease? You all know we had gone through several times some different aspects, including the medical terminology. It's called deep vein thrombosis. It's called a DVT or pulmonary embolism, which is that is a block in veins. It may be mostly the deep vein thrombosis you can see in the lower part of the leg, in the your calf muscles, and there you can see the blue and pain. So that is the deep, this is the clot forms inside the vein. And pulmonary embolism, if there is any blood clot in the lung anywhere, is called the pulmonary embolism. So blockage in the veins due to clots. Atherosclerosis is artery, atherosclerosis or atherosclerosis almost same, is a plaque build up in the arteries. What the plaque is built up from the cholesterol deposition or fat and blocking the artery so that the blood cannot flow properly. Myocardial infarction is called the heart attack. Myocardial infarction is heart attack. What is heart muscles begins to die due to lack of blood flow. That means either there is a blockage, so the blood cannot go, or there is a muscle damage. Hello?
Question.
It's called,
Chapter Unit 3 have two parts to it. I think you missed one of the part. I'm
no,
not
I
sure.
didn't. I will go later. That is
Okay,
the
okay.
that is the renal. There are two parts.
Yeah. Oh,
Yeah,
okay. Yeah. Okay.
renal and the
Mhm.
cardiac. I became able to work on the cardiac because I tried to focus on those which is not important. I was just skipping it. That's why.
Okay.
Yeah.
Okay.
Okay.
Thanks. Thank you.
Okay.
Okay.
Myocardial, because it's a huge number of slides which doesn't need all the information, doesn't need. So I thought it's better
Okay.
to make you more focused, which is important.
Okay.
Myocardial
Okay.
infarction is a heart attack. Heart muscles begins to die due to lack of blood flow. It may be any reason, the blockage of the artery, or maybe the heart muscle is weak, it's some kind of bad infection, inflammation, anything. Angina, when that is you feel pain, chest pain, that is called the angina. Dyspnea means shortness of breathing. These terminologies you have to remember not only for this model, throughout your career, life, everything, because anytime medical terminology is very important. Stroke is different from the heart attack. Stroke, when there is a block in the brain, blood flow in the brain, that is the stroke. Arrhythmia, you guys know, irregular heartbeat. The heartbeat is not normal. Sometimes it's irregular, means it's maybe fast or low, taking long time. Sometimes it's some up or very speedy. In next phase is going to be low. It's irregular. It's not the normal rhythm, sinus rhythm. So what are the different tests for cardiovascular disease detection? Mainly we do the blood work and ECG. Blood work is one of the main important parameters for considering the or detecting the cardiac damage or heart attack. And another thing is ECG. We do that, which can show you any heart damage. And the other technologies can do ultrasound to check your valves, MRI, stress test. There are different other parameters doctors order to check for your cardiovascular diseases. So now what we are measuring, blood test means what? We have to know something like what is the markers for the cardiac arrest or cardiac problem. There are different cardiac markers, which are the biomarkers. Why is called biomarkers? It is inside. The markers are present inside your body. So it's the cardiac markers are the biomarkers. It is used to evaluate your heart function. These cardiac markers are generally elevated when there is a heart attack, angina, or heart problem, sometimes shortness of breath, even you are not feeling the pain, maybe you are feeling very difficult in breathing, shortness of breath. So these are mostly the enzymes. That's why sometimes it's called the cardiac enzymes also used as the cardiac marker. So what we are doing for the blood? Generally, whenever any patient comes or you are feeling, especially the cardiac related problems, people comes in the emergency, or if you go to the doctor, doctor will send you to the emergency. So you need a sample, blood sample. Blood sample should be collected whenever the patient come in on admission, and from there on, you have to collect the blood 2 to 4 hours to 6 to 8 hours, and it can go up to 12 hours to 24 hours later. Because if there is a heart attack, the biomarkers is going to be released in the blood and is getting slowly evaluated or increased, and increased maximum at the probably 24 hours, then it slowly go down, but it stays, some markers stays for long days. So you have to make sure when you are doing the MI, say for we are suddenly seeing the high trope, immediately we order the trope, immediately we order the ECG and everything. So making sure whether heart attack is going on or that is expected. From the seeing the levels of your biomarkers, especially we are going to talk about the troponin, you can understand that whether the patient has the chance of a heart attack from 2, 4, 8 hours, or the patient is stable, or patient has no troponin. So are the chest pain or something is not related to cardiac. But it goes the peak depending upon the which biomarker you are using. Generally, we do On admission, after 2 hours, before you used to do 4 hours, 8 hours, 6 hours, 4 hours interval. Nowadays, there is a high sensitive troponin has been uh, used as a cardiac marker, and it has been used every 2 hours interval to check. So, what are the generally current markers as a combination of diagnosis of acute MI and myocardial injury, troponins and myoglobulin, myoglobulin, but mainly the troponin. MB is not exactly specific to heart. It's a muscle. Myo means muscle, muscle globin. Obviously, cardiac heart damage, it will increase. But at the same time, if there is other muscle damage, it can also increase. When there is a cardiac problem and increase along with the troponin, that is obviously the sign of cardiac markers. So what are the different cardiac markers if we continue? So before the introduction of cardiac markers, that is the troponin, cardiac specific troponin, before which was used as a cardiac marker is called the creatinine kinase MB, or you used to call it CKMB, and lactate dehydrogenase LDH isoenzymes to diagnose and assess the myocardial damage. But nowadays, the most specific is the cardiac specific troponin is called the CTNT and CTNI. These two isoforms of troponin is released when there is a cardiac attack in the blood, and you can measure it every 2 hours intervals to make sure if there is a chance of heart attack, or there is a foreseen that this patient may have heart attack, or there is no danger. So it's called the serial sampling of cardiac markers. It's performed after onset of symptoms or when the patient is coming of a myocardial infarction or MI, such as chest pain or shortness of breath or feeling numbness or weakness or pain. Some pain is radiating from your chest to back. So there is a time window during which cardiac markers are released from the myocardial tissue, means from the heart tissue, and elevated values in the blood. So this is the graph they are going to show you how we can read a little bit later. So now let us go to the troponin. Troponin is currently acknowledged as the gold standard of cardiac biomarkers because it has excellent sensitivity and specificity. What are the troponins? Troponins complex is consists of 3 components. It's called the troponin T, troponin I, and troponin C. Troponin C is not getting tested in the lab. Mainly the troponin T or troponin I. These are the 2 troponin gold standard cardiac biomarkers is used nowadays for detection of any cardiac arrest or cardiac problem or heart attack. Troponin levels increase sharply within 3 to 12 hours after a heart attack, and it's a peak about 24 hours. And they remain high for several days. Maybe sometimes you have a heart attack, you had heart attack, silent heart attack, but then you are having the pain. Maybe you have yesterday, maybe you are having after 3 days, you are still having you are feeling the pain again or something like that. That time, if you can come to the hospital, they can do the troponin, you can see there was something then followed by the ECG and other things. So they remain high for several days. Peak is at about 24 hours. So that's why generally we do 2 hours interval. The largest portion of the troponin released into the blood circulation after damage to myocardial tissue is in the form of complex with TNC or TNI also. So troponin remains elevated in the blood for 4 to 10 days after myocardial infarction and thus are valuable for late presenting patients. who didn't able to understand or who probably ignored that was that, okay, the chest pain came, heart attack happened, and then they feel okay. But then after a few days, heart damage, they are feeling something is not normally, they are feeling some difficulties breathing or some again mild pain or some discomfort, they come, we can do the troponin, we can see it may be the high troponin level. That means the patient may have a heart attack, which is going to be reconfirmed with other tests. So there is the things in addition to the direct heart attack, the other condition that may elevate troponin, chronic kidney disease, pulmonary embolism, obviously there is a clot formation, congestive heart failure, heart surgery, arrhythmias, sepsis, strenuous exercise. Physicians are trained to look at the whole picture and ECG. So now, except the troponin, that is the master one, the current gold standard, but there are a couple of other biomarkers we need to know, is the myoglobin. It's mainly present in the muscle, skeletal muscle and the cardiac muscle. So it was an early marker to injury to muscle tissue, any muscle tissue, cardiac and other muscle tissue. So risk in MB concentration is detectable in blood as early as 1 to 3 hours after the onset of MI. So now you can understand that the MI, you can do the, nobody is going to write for a myoglobin test nowadays when there is a troponin. But it was helpful before when there is not this troponin I or troponin has been not being detectable or not being established in the research field. The disadvantage of MI is that it's not cardiospecific. So it can be increased in trauma, disease of skeletal muscle, renal failure, or anything. So need that. Another one which used to use before the troponin is the creatinine kinase. Is increased after a muscle injury. So CKMB is relatively cardiospecific, they said, because extremely sensitive within 4 to 6 hours after onset of MI. So CKMB when used to measure, we are not used to measure after 2 hours because the level is increased in the blood after 4 hours. So from 4, then you used to measure 8, then 4 hours interval in the MI patient. So before there was the troponin, we used to use the CKMB as a specific markers for the detection of the MI. But this CKMB, as it is muscle specific, when the MI incident has gone, it decreases. When you are treated with the, so it decreases rapidly days following the MI incident. Whereas the troponin stayed for a long time. So it, even the delayed patient, you can catch it. So you can see this is the myoglobin, it immediately deteriorates. CKMB is goes up, non-specific those one, but it goes immediately pick up and then goes down. But CK the troponin is coming in 24 hours still for long time. So it give you the broad spectrum to understand whether the patient has giving any MI. There is another one is called the homocysteine. Nobody use this one nowadays, but homocysteine is a risk factor for heart disease when there is a high level. It's an amino acid. So in case when it helps, maybe you are not assessing for the cardiac problem, maybe you are assessing for from different problems, and doctors they say the homocysteine level is high. Immediately maybe they may go back and check for the cardiac profile. So it's called hyperhomocysteinemia is related to the high risk of chronic heart disease, stroke, peripheral vascular diseases. So where we can measure the homocysteine? It can be in the serum. C-reactive protein. That is another one. C-reactive protein can be increased for any kind of inflammation. Whether you have the bone inflammation, arthritis, you have joint problem, you have any lung problem, anywhere, any inflammation, C-reactive protein is going to cause the acute phase reaction because it's going to be elevated suddenly. So C-reactive protein is called the acute phase reactant. It's a protein. From the name you can understand C-reactive protein, which increases due to an inflammatory response in the body. It is not specific to the heart, but there is a heart inflammation, obviously it's going to increase and show. So cardiovascular disease also is now considered a process with a low level of inflammatory component, because when the heart cannot function or heart has some problem, there is the inflammation is going to go on there too. So it is not used as a detector for MI, but it can be used as a detector for a cardiovascular disease. And obviously it is increase in atherosclerosis. That means where is a deposition of blood formation, there would be inflammation in the arterial. So that we told the CRP is most sensitive and is an acute phase reactant for the inflammation. There are now, as more research is going on, they are doing more and more digging into more inside, and now they can detect two types of CRP. One is the traditional, which is for any kind of inflammatory process. So if they see there is the increase on the C-reactive traditional, and patient is complaining also something discomfort is heart, or maybe it's related to heart problem, or the family has a heart problem, they can order for high sensitive CRP, which is more cardio specific. It's called the cardio CRP. There is another one nowadays is used for the natriuretic peptide. It's a protein. It's called the peptide. Okay. So natriuretic peptides is called the BNP. Why is it called the brain natriuretic peptide? It was supposed to release from the brain. That's why it's called the brain natriuretic peptide. It's a hormone. It's released by the ventricles of the brain. So heart, what the brain releases the peptide, but heart is the major source of circulating the BNP. So if the heart doesn't function properly, it cannot circulate the BNP. So nowadays, in addition to troponin, sometimes the doctor's orders BNP used as a diagnostic tool for congestive heart failure. So that is the congestive, the heart cannot function anymore, is a congestive heart failure. There are some other different miscellaneous markers, fibrinogen, acute phase protein inflammation, D-dimer. You can see sometimes often with the cardiac, they order the D-dimer. D-dimer is the clotting things. So in addition to the troponin or heart problem or anything, doctors like to know if there is a clot is forming. So that time the D-dimer in association with the other cardiac marker assay, it helps you to give you more information if there is any blood clot formation or is going on. Then they may send you to the ultrasound. They may send you to the CT to make sure where the clot is, whether it's the heart, in the brain, or the artery, or wherever. So doctors can decide that one. Microalbuminuria. We never do this one. But who has the diabetes, they have the problem in the albumin. The urine comes in, they produce more albumin in the urine. So this microalbuminuria, who is the diabetes, this may contribute some cardiovascular risk. The main important things you have learned from here is the troponin, importance of troponin, how long it can stay, where you can get the peak hours, and what were the previous biomarkers was there, CKMB, LDH, and so, and how you are going to do that, how long is going to stay in the blood, which one is going to stay in the blood, which is specific, where's the myoglobin, which is specific for the heart, which is non-specific for the heart, which can use as a diagnostic tool for the assess of the cardiovascular disease. So these are the risk factors for the cardiovascular disease, including ending in the heart attack or congestive heart failure, high blood pressure, high cholesterol, tobacco use, includes vaping, type 2 diabetes, family history, lack of physical activity, diet high in sodium, fat, and sugar, misuse of prescription and recreational drugs, chronic kidney disease. So, how you are going to keep 10 steps to protect your heart, see your GP for a heart health check, follow healthy eating pattern, move more, no smoking, try to keep a healthy weight, drink less alcohol, reduce stress. This is not possible. Manage your cholesterol, manage your blood pressure, manage your blood sugar, and you will be fine. So these are the reference range for the CKMB, troponin, and troponin I. So anything, generally we are measuring this one in the hospital, microgram per L. This is the high sensitive. Troponin T, this is also high sensitive. So less than 14 is good. It depends upon which analyzer is using. So less than 14 is fine. Sometimes we see troponin T value is going 28,000, 60,000. Patient is not feeling anything. Patient is says, so they came for some discomfort. Immediately sent to the acute. The patient is going to have an heart attack soon. What questions you have? Anything? No? Move on. Yes? No answer.
Miss,
Yes.
I have a question.
Yes, ma'am.
It's not about that. It's just the review. Can we spend the rest of the time for the review? Or you can give us some time for the review, please?
No, for the review, you have to work on today, as Christiana suggests, of the class, because I have to complete the next unit, last one. I try to make it more short, the renal one, and then you guys can go. What you are not here, Christina said. If you guys are okay, you can spend some extra time. How long you want? Half an
Okay, no
hour, 1
problem.
hour. Tomorrow is the Thursday, right? I'm going to set your
Yes.
exam in the second half, right, from 11 or less, whatever. I will see the what time frame. So in the morning also you can discuss with the review.
Okay. Thank
Is
you,
that going to
Miss.
be helpful? Yeah, that I'm going to
Yes.
set your exam at the end sometime, so that the Friday we have to do more unit 4, 5, 6. I don't know whether you will be able to do that. If not, I have to move the exam, final exam later. Because there are a lot of informations there too. I don't know why they are giving so much information, but unfortunately it's like that. I thought maybe you guys can do the first half of the review, first half of the exam, and then I can move on to the. If you guys okay, you can start complete the review by today. So maybe we can do the first half of the exam, and then second half we can start the rest of the units and can complete by Friday.
Okay. Which one?
Tomorrow.
Tomorrow.
Tomorrow is for the unit 1 to 3, and then Monday I booked the computer for your final test. But till we have to learn, you see how much information they are giving, how many slides is so much, how even I'm trying to jot it down, but till it's not possible for me to complete all the units.
Yes, Miss.
So
I was wondering, like this course, at least minimum 2 weeks. I don't know why they're giving only 1 week.
Yeah, I
Um,
don't know. If I cannot, maybe I will cut down something from your practical class and maybe I will have to reschedule. Maybe I will take the class in the LSP. I'll see Friday how it goes. How it goes, and maybe I will decide that one whether I'll take the test on Monday. But try to study as much as possible in the weekends. I'll
yes.
try to send you the reviews, even not the unit is not completed. At least you can have a look. Okay, and what is has been learned, you can work on that. Okay, I'll try. I'll try. It's very difficult for so much
Thank you,
information,
Miss.
unnecessary information.
Yeah.
Yeah,
Unnecessary information.
yes, ma'am. It's so many information. So
I
I'm
know, dear.
wondering
What I can
if
do,
I could take the exam tomorrow, can you please like send us the simple material, simple PowerPoint, simple.
I cannot. These are on the D2L.
It's all because D2 is material is so
I understand. I
too
cannot change
much.
or anything. What I am doing is immediately is not saving anything.
Okay,
When I'm
I
showing, I'm just
'cause-
computer, I'm just highlighting something. Okay? But I cannot
okay,
save anything. I cannot save anything.
Yes,
okay.
we can
So
finish the slides when we come in person next week, and this in the campus. I mean,
I don't understand, Yusra, what
how
you say. Could you please
yeah,
repeat?
yeah. I mean, like since Friday is going to be like very short time to finish the slides, we can finish them in person next week.
That's why I'm thinking I'll see how far it is go, and then I will take the decision whether we can continue our study up to Monday and you can take the exam on Tuesday. Okay? That I'm
okay.
going to see how it goes. How it goes. I cannot right now say anything. Tomorrow you give the exam, but Kara, you got my email?
I got the 3 emails that you sent to everybody, like the reviews and the ML information. Is that what you were talking about?
No, no. I had send you one direct email to you, and that is only you. You just check that one. Okay, okay,
Okay.
okay,
Is it my
okay.
school email or personal?
I think school email. I'll check. I don't
Oh,
know. Okay, maybe school email.
okay.
Yeah. Okay.
Sorry, just make sure everyone just receive the 2 emails, right? One is for review and another one is email power. I got 2, right?
No, you got 3 emails. Everybody got
There's
3 emails.
yeah, there's
One for
another
your
one.
Oh,
practice, one for you have to practice for the review. One, I helped you with all the reviews, jotting down all the points from all the PowerPoints, the specific precise one, so that it can help you to study and give you the help to give the find the answers.
okay. Thank you, mom. Because I just received 2 emails. Okay, I'll check
Yeah,
it
there's
on
the
this.
3 emails. That is the 3 emails. One for the ML Power exam. Forget about that.
Yeah.
Related to
Okay.
this unit 1 to 3, I had sent you two another emails. Okay, one test your knowledge and one is for your review study. The heading is study, so that helping in your study, right?
Okay, I check.
Everyone
I
got
check.
that?
Yes, yes, ma'am.
I
I
got
didn't
one.
get
Okay.
I didn't get a review study. I get clinical chemistry review, and
Yes.
that's the highlighted one. And then I get another
That
one.
is for your study. You if you just write it the subject heading is for study.
Oh, so,
Yes.
so that's for tomorrow? That's for tomorrow's study, or the one that we're
Yeah.
considering?
No, the time tomorrow study for everything, whatever I'm doing, also tomorrow. Yeah.
Okay,
There are a
so
lot
the one
of
that,
information from the tomorrow also.
oh, so it's both of them where the 1 to 3, unit 1 to 3 is the test of a knowledge.
Hmm.
That one with the highlighted one, they're both for tomorrow.
Yeah, majority of them. I cannot say that because there are, I told you in this model, there are a lot of LSP, LSP, LLSP, endocrinology, everything from your previous knowledge is there. It's not like that everything we are last teaching you right now, but you already learned it. So some questions may come. So I just give you throw some lights in your study. so that what type of study you should know about that. Okay.
Okay. Thank you, Miss.
Okay. Okay. Savannah, you are here? Okay. Good.
Yes, ma'am,
Sometimes
I'm
I can.
here.
Okay. Okay. So let us go to the next one. I don't know how much I became able to do that. Okay. So this is the urine one. Not urine, it's the renal function. Renal means related to kidney and that kidney structures, right? So you guys know already, you have learned before, when you do the urinary system composed of couple of parts. You have the kidney, pair of ureters, but one urethra, one bladder. So upper part of the kidney consists of kidney and ureter, whereas the lower part of kidney or the urinary tract is called the bladder, urethra, and the opening. So, and you know all the structure inside the kidney. We have already learned how the urine forms, what are the different structures, what is the calyx, what is the pyramid. We have learned everything when we learn the anatomy of the kidney. So ureter is taking the urine from kidney and is putting in the bladder. Bladder is holding the urine and then is going to release the urine through the urethra by the operation of two sphincter muscles, internal and external sphincter muscles. And now you know the inside how the filtration urine formation occurs through the filtration system of the kidney, glomerulus, and the total system. So what is that? The blood from the arteries or arterioles or venules comes in the glomerulus, the cup-shaped things. You can repress that one, and then this is the blood capillaries, right? From here, all the things which needs to be filtrate under the high pressure, it is getting coming to the glomerulus and then is coming to the proximal convoluted tubules. And here the blood, the capillary is going outside here also. So then these are the different steps: glomerular filtration, tubular reabsorption, and tubular secretion. Filtration, water, solutes, which is smaller than protein. Any protein cannot pass through the from the capillary to the glomerular filtrate. So, and then it goes to the Bowman's capsule and go into the system in the proximal convoluted tubule. Okay, and then the tubular reabsorption. So now everything has been come out from the filtrate, the glucose, sodium, potassium, everything. Now tubule is going to reabsorb some of them which is needed to maintain your homeostasis of the body. And finally, what are those? Mainly water, glucose, amino acids, needed ions are transported out to the filtrate into the tubule cells, then enter the capillary blood again. So from here, these are needed is going to come to the capillary blood. So it's restoring in the blood. And tubular secretion, creatinine and drugs are removed from the peripheral. Even if drugs is going to be get out from the system. So renal disease cause due to kidney failure from the diabetes patient at 36%. Chronic kidney disease or kidney failure increases a patient risk to cardiovascular disease. So more diabetes patient has more high risk of the cardiovascular disease, CVD. A variety of laboratory assays can be performed to support a diagnosis of renal disease or dysfunction. Okay. What are the different parameters we can check for renal test? You are measuring the urea or urea nitrogen. You can measure the creatinine clearance, glomerular filtration rate to make sure how the glomerular is filtering the substances, cystatin C, creatinine, uric acid. So there is one creatinine and one creatine and uric acid. There are sometimes some questions comes between creatinine and creatine. When the question will come, make sure whether they are asking creatinine or creatine. What we are going to see in your questions or in your discussion also. So liver is the whole site of urea formation, regarding the urea. So when protein breakdowns, any protein in the body breakdowns, ultimately it form a product called the other products is called ammonia. So ammonia is a toxic substances. Sometimes that's why ammonia can be seen as the doctor's orders of ammonia to see whether the toxic substances is forming in the body. That means the protein is breaking down and the liver cannot take up that. So it is a potential toxic substances which is generally removed by the liver. But sometimes some ammonia combines with other amino acids and converted to urea. Then, so ammonia is harmful when the excess ammonia and the ammonia is not getting able to remove by the liver. So then it can combine with something, some other amino acids and form the urea in the liver. So urea is the waste product of protein metabolism, right? So
Yes,
urea
ma'am.
is, yeah, because from the protein is getting to the amino acid, the ammonia, and then ammonia is then mixing or reacting with some other amino acids to make from the urea. So urea is the waste product of protein metabolism, which is normally removed from the blood in the kidneys. So urea, liver is helping the forming, get rid of ammonia, then is some exit from the urea, then this urea is releasing in the blood, and then from the blood it is getting removed from the kidneys. The The amount of urea in the blood is determined by the amount of dietary protein. How much you are taking too much protein, that it may cause you to release more urea, which cannot be taken care of the liver by the normal process, or kidney's ability to excrete urea. If the kidney is not functional or impaired in function, it cannot excrete the urea. Also, like the kidney dysfunction can impair a lot of other parameters, also urea one of them. So that means the cell kidney is impaired, it accumulates more urea in the blood. So an increased concentration of serum and plasma urea may indicate a flaw in the filtering system of the kidneys, right? So kidney cannot filter the urea out. So that's why the serum and plasma urea level is increasing. The of urea is only a rough estimate of renal function. It's not the total, because not only the urea, there are other things which is getting excreted through the urine. So it will not show any significant level of increased concentration until the glomerular filtration rate is decreased by at least 50%. That means when the kidney is really damaged 50%, or the glomerulus is not functioning 50%, only then you can see the high level of urea. So that's why instead of urea, there is another component is going to see in the blood. ইলুলু করেছিল কোথায় ফেল নিচেটা নতুন লেগে যায় So now what is the more reliable renal function test is creatinine, because this is independent of your protein intake. So urea may increase if you are taking more protein diet, but the creatinine is not dependent of the protein diet. So it is independent of protein intake, degree of dehydration, and protein metabolism. I'm trying to highlight which is really important for you guys. So urea may be determined directly from the serum. What type of serum? It can be lithium or sodium serum. It doesn't matter. Urea is not reacting with the sodium. You can use from the plasma. You can urine or other biological specimens. Only the anticoagulants, which is the fluoride, like the great up tube, you cannot use it because it interferes with some enzymes, which called UDAs, which break down the urea. So that means if you take this urea sample in the great up tube, it is going to break down the urea. So whatever urea has in the patient sample, you are not going to exact value. So great up tube cannot be used for urea. Or also another thing we learned for the electrolytes for the potassium. Generally, we don't use those, but it is for your knowledge. Okay. Urea can be lost through bacterial action because the bacteria, if there is too much bacteria in the blood or urine or any sample, it can destroy the urea. So the specimen should be analyzed within a few hours after collection or should be preserved by refrigeration. Okay, that is the 4 to 8 degree or 2 to 6 degree. So refrigeration at 4 to 8 degrees centigrade preserves the urea without measurable change up to 72 hours. That means if you cannot do it, you can save the sample in the refrigeration without any decay or damage up to 72 hours. So creatinine is mostly found in the muscle tissue, 95% in the skeletal muscles, where it stays as the creatinine phosphate. This is serves as the phosphate means high energy reservoir for conversion of ATP. That's why creatinine, creatinine stays in the phosphate and it gives and source in the muscle. You are always moving, right? Muscle is more active. So you need the energy, muscle cells and energy. So from this phosphate bomb, it helps to conversion of ATP, ATP is the main source of where you are getting the energy. It is independent of diet. Syrup creatinine concentration almost entirely dependent on excretion rate by the kidneys. So that means good marker of kidney disease. It is independent for anything. So if there is high level of creatinine in the blood, that means the kidney is not directly functioning. It's independent of diet, exercise or anything. Okay. Creatinine in the blood results from the spontaneous formation of the creatinine from the creatinine that we told you, right? So just give me. So this comes. Females usually have lower creatinine than the females because males has the more muscle. They are using their more muscles. Females is less. So that's why therefore creatinine concentration varies with size, age, and gender. That's the question sometimes comes. Okay, and females has lower creatinine level than the males. And clearance of creatinine from the plasma by the kidney is mainly increased as the indicator of glomerular filtration rate or GFR. How much is getting removed from the glomerulus at what rate? So what type of samples you can use? You can use serum, heparinized plasma, anything, or diluted urine can be assayed for creatinine. So you never use the ammonium heparinase. We don't use it. So it said ammonium heparinase plasma should not be used because it may interfere. Okay. So for the urine, for measurement of the creatinine, you have to dilute the urine 100 to 1 is to 100 to 1 has to 200. Now you know the dilution. Why you need to know the dilution, right? So for dilution of 1 is to 100, how much urine is going to take and how much diluent you are going to take?
1 urine take.
99, ma'am.
1 ml up?
Dilution,
1 ml up?
of urine to 99 mils
99
of distilled
ml
water.
of diluent. Okay, good.
Yes, ma'am, diluent.
So now you guys have idea good what is the math, right? Okay, good. So creatinine is stable in the serum for plasma 1 week if the specimen is refrigerated. Again, you can keep the serum and plasma up to 1 week. It's very stable. It can stay up to 1 week. But it has to be refrigerated. Okay? Okay. It is important to separate the cells promptly to prevent hemolysis and to minimize ammonia production. Hemolysis is okay. So everything we need to immediately separate it. We know that. So most methods for creatinine employed the Jaffe reaction, the oldest clinical chemistry method still in use. Nowadays, nobody does this. Everything is in the autoanalyzer. So I don't know whether we need it or not. Like can is alkaline filtrate to formal. There is no need to improve species. The reaction element interaction from the many non-alkaline filtrates. It doesn't need this one. Okay. You doesn't need this one, but in case, so how it happened? Creatinine in the test method, you have the picric acid, it reacts and it forms a creatinine picrate complex. And from that estimation of the creatinine picrate complex, you can see how much creatinine is there. This is not that much needed. Okay. No need for me. So it's a sensitive indicator for kidney disease indeed. Creatine is freely filtered by the glomerule in the kidney with a small percentage secreted in the renal tubule. It's freely filtered in the glomerule of the kidney. So it should be good indicator. In renal disease, creatine excretion is impaired as reflected by the increased concentration in the blood. So even in the renal disease, when there is creatinine cannot be cleared through the urine, then there will be elevated in the blood. So elevated serum creatinine is associated with increase in the glomerular filtration rate. This is important. So that means when there is a elevated serum creatinine, that means it's not getting the glomerulus cannot filter the creatinine in its proper rate. Is that raining or no? So clinical significance of creatinine, what is that? The concentration of creatinine is not affected by dietary intake. We already told it's independent of that, independent of dehydration in the body, protein metabolism, nothing, which makes the assay more reliable. Single screening index of normal. So this is very specific test, the creatinine clearance is a useful index related index excretion of muscle in body weight. That is not the creatinine clearance. Oh, it's okay. No, this is the globular filtration. This is much better. So what is the rate? What is the creatinine clearance rate means? It is defined as the milliliter of plasma cleared of creatinine per ml. Creatine is cleared per ml of plasma per minute by the kidney. So per milliliter of plasma, how much creatine is cleared by the kidneys per minute? Okay, so that is the creatinine clearance value. And it also depend upon the height, weight, and age and sex of the age and gender of the female. Okay. So this is important for to perform the test. Timed specimen of both blood and urine must be collected. You need both blood and urine. That is another thing. All voided urine must be carefully collected for 24 hours. You need the 24 hours urine. Urine specimen is preserved by refrigeration as successive addition are made to the total collection. So every hour, if they tell you have to collect every hour or 2 hours, 4 hours, so you have to collect the urine and you have to keep in the refrigerator because creatine is stable up to 7 days. So you can keep it, but you have to keep it refrigerated. Blood is collected within 24 hours of the urine collection completion. So you are going to take first blood and within 24 hours after the urine collection is complete. Patient height and weight and also needed to provide it on the patient requisition. So you need both blood and urine. You have to collect for the creatine clearance. From where the creatine is cleared? It is cleared through the kidney. So you have to collect the urine at the time intervals and you have to, after collection, you have to keep in the refrigerator. That patient has to do that, right? Or if you are in the hospital emergency embedded, the nurses are going to do it. But in general, for the creatine clearance, they will give all the bottles, all the instructions. So you are going to collect the urines as per the time it's been written by the requisition per hour or 2 hours or 4 hours, whatever as per the need. And then you have to collect the urines and you have to keep it in the refrigerator. Patient has to keep it in the refrigerator. And then at the beginning, you have to collect the blood sample. And at the end of the completion of the urine collection, you have to collect the blood samples. So again, this is the So this is the formula for the creatine clearance. Use the urine creatinine concentration. What you are going to do, then V is the all water. So V is the volume millimeters of the urine excreted per minute, which has been calculated from the total volume per hour maybe. And A is the patient body surface area in square meters, and 1.73 is the standard body surface area in square meters. So that's why they put it. And most automated analyzer have calculating capabilities for this value if the specific patient height and weight data are entered into the system. So it is the automated analyzer does everything. Nowadays, we doesn't do anything. Only they take the unit. You have to collect the sample per hour or per 2 hours, and you have to collect the volume. You have to measure the volume. You have to know what is that, and in their height and weight. So it's going to automated analyzer is going to calculate it. But this is the formula. I don't think you need to remember it. But anyway. Now, glomerular filtration rate. So, glomerular are the tiny filters in the nephrons with into your kidneys. Okay. So, this is the Bowman capsule and this is the glomerulus, the network of capillaries. These filters help to remove waste and excess fluid from the blood. They also keep larger formed elements and the protein cells inside the blood. The proteins, the bigger molecules cannot go out. So this acts as a strainer. Damage to glomerulus would allow larger elements like proteins to filter through. So if there is a damage in this network, if the tear the sieve, but the sieve holes become more, so larger molecules will go out in the urine. So that's why glomerulus are very important. All parts of the bodies are important, which is not important. But any damage, any hair is got cross problem, health problem. And glomerular is called the filtering unit of the kidney. And GFR is one of the most important indicators of early kidney disease, especially who has the history of diabetes in the family or some kidney failure problem or anything. Generally, doctors after some age, they order for the GFR. So various substances in the plasma and urine can be used to estimate the GFR. But measuring a plasma or serum marker for GFR by using an estimation of equation for GFR, anything, any marker. So GFR is the measurement by urinary clearance. Exogenous substances should have the following characteristics: should be physiologically inert, okay, should be freely filtered and not bound to protein, should not be reabsorbed, secreted, synthesized, or metabolized by neural tubules. It's okay. GFR, you can just from whole slide, you can just remember one thing. GFR is one of the most important indicators of early kidney disease and also ongoing kidney problem. Glomerular filtration rate estimates how much blood passes through these filters each minute. So, see here, this is the knot of capillaries. So from here it measures how much blood is passing through these filters per minute. So how much blood is passing through these filters per minute? No direct method is available to measure GFRs or the quantity of glomerular filtrate formed per unit time in all nephrons or both kidneys. Blood. In theory, the amount of substance has been filtered. Say, for example, 20 milligram. Just give me a second. Hello. Yes. I can't understand what you are saying. Yeah. Okay. Maybe I cannot remember right now. Teaching in a class, so I cannot remember right now. What where they got that I need a medical device or the alarming system? I don't know. I said I need I said so far I'm physically okay, not need the medical device alarming system. My goodness. Okay, sorry. So basically what you are telling that whatever is excreted, taking out the filtering from the knot of capillaries or glomerulus into the urine, basically it should be equally is going to come to the same proportion or same amount should come into the urine. That is, they are taking the amount of substance filtered from the blood or plasma by the kidneys should be equal the amount excreted in the urine. So inulin is a component which has been used has been gold standard for measurement of GFR. So inulin, how much inulin is getting out from the blood, filtered to the kidney and coming to the urine, it is getting an indicator or marker for measurement of the functioning of or accuracy of the GFR. Or an alternative to inulin clearance is the measurement of radio level substances called ethyl-thalamate, but they have to put this radioactive substance in the body, but mostly they use the inulin. To determine the GFR with these compounds is rarely done because of cost and inconvenience to the patient, obviously. Who is going to, for the GFR, who is going to put the radioactive substance in your body? As this is not technically test that is performed, it is now a calculation, is not an orderable test. So this is not getting order right now. It generally calculated using a formula that compares a person's age, sex, serum creatine levels. So from the serum creatine levels, they can understand. So a GFR under 60 ml per minute per 1.73 make in mean kidney disease. This filtration unit doesn't need to that much. You have to remember only you can see this effective tell you regarding the estimate how much blood has been passes through the filters. Because this is not an orderable test now nowadays. As the science advances, as the research advances, they are doing more intricate and more better system, right? So prognosis of chronic kidney disease by GFR and albuminuria categories, how we are going to go from this value to this value. So G1 to G5, the filtration rate. So you're going to be, if it's too much, then you are going to be the red zone. The another one is cystatin C. This has been identified super marker for the GFR assessment. This is very important. Cystatin C has been used as an superior marker for creatinine GFR assessment. It's a low molecular weight part of the system. Formerly, cysteine doesn't need that. The significant advantage of cysteine is that it is present in constant amounts in all body cells and is not influenced by the muscle mass. So this substance is present all over in all body cells. So it's not only the cardiac, not only the brain, not only here, not on the lung, not in the digestive system, it's present everywhere. So that means it's producing from whole body system and is getting cleared by the kidney. So cystatin C is measured by two techniques that you have to remember. It's called the turbidity meter or the enhanced nephrometry that we have learned. Okay. So this is need to be in bed. Either you can use the turbidimetry method or the nephrometry method where the light scattered. So GFR is inversely proportional cystatin. That means if GFR is increased, means low cystatin level. So that means GFR elevated, low cystatin concentration is decreased and vice versa. So for the cystatin C, what type of specimen you need, which is more important for us? Overnight fasting is required, so more than 12 hours. It's almost minimum 12 hours, more than 12 hours. Collect blood in the red top serum tube, no additives. Okay, red top serum tubes. Transport to aliquot tubes and refrigerate for transport to lab for testing. So you are collecting the serum tube, you are following the procedure, then you are collecting the separating the serum and keep the serum in the refrigerator for transport to the lab. Not every lab has the ability to test for cystatin C. It's very specific lab can do that one. Very rarely people order this cystatin C and other things. Mainly all the urea, creatinine, nitrogen, these are the mainly things for the kidney function. The creatinine. Creatinine is one product, creatine is another product. Creatine is synthesized primarily by the liver and transported to the other tissues. It's synthesis in the liver. It's the organic compound that facilitates ATP recycling. Forget it. So creatinine is synthesized in the liver and transported to the other tissue. That is the thing you guys can remember. Creatine can increase the performance of athletes in activities that require quick burst of energy. That is, sprinting can help athletes to recover faster. Creatinine test is rarely performed. What you do the test is the creatinine. So don't get, if there is options that are the kidney function tests, mostly creatinine, urea, or creatine, amine, don't put it the creatine. For the kidney function test, mostly we use creatinine. Okay, so that is the things they are putting it here so that you guys doesn't make confusion between creatinine and creatine. Creatine kinase we already know for the heart is a muscle enzyme, right? Creatinine kinase which breaks down the creatinine. So creatinine kinase converts creatinine into creatinine phosphate, thus giving the high energy phosphate bond. So creatinine phosphate converts into creatinine. So if there is a muscle problem, muscle breakdown, then you can see the creatinine, but creatinine is going to come in the blood. Creatine is going to stay mainly in the form of creatinine phosphate or in the muscle. Creatinine kinase values can be high in the blood due to muscle damage or intense exercise. Yeah, myocardial infarction, we already discussed about that. It can be used. So now, so what is the difference between creatinine kinase and creatine kinase? There are the creatinine and creatine kinase. Creatinine is the breakdown product of the creatine phosphate. So creatine phosphate is present in the muscle. And when it breaks down, it forms the creatinine. So creatinine is the product after it breaks down from the creatinine phosphate. So when there is a muscle use, muscle damage, problem in the muscle metabolism, then the creatinine kinase enzyme is breaking down the creatinine phosphate to creatinine. You guys all going to be researcher in one day after taking this course. So what is the clinical significance?
True.
Elevated levels of creatinine and creatinine kinase are found in muscular diseases, injury in muscular dystrophy, or even there is a cardiac muscle problem. Creatine is testing rarely performed. So be careful because there is no need to test the creatine because creatine is already in the muscle in the form of phosphate, mainly creatine phosphate. When it breaks down, it forms the creatinine. Another parameters for the purine metabolism is the uric acid. Uric acid is mainly involved in the what type of problem? Uric acid can be seen when
Gouty
Gout.
arthritis, ma'am.
arthritis is the crystal. It's the acid, but it's kind of concentrated form. It's kind of from the crystals and give you pains like the needles. So uric acid is the final breakdown product of purine nucleoside metabolism. You know the purine. What is the purine in the DNA? Also, right? Purine, pyrimidine. You remember the DNA structures? Sorry, guys. So there are three major diseases can be associated with the elevated plasma uric acid. Gout, which cause the increased catabolism nucleic acid. Nucleic acid is present in the DNA, right? Purine and pyrimidine, and in renal disease. Renal disease because it cannot get out. Both renal damage and increased nuclear catabolism resulting from chemotherapy contribute. So chemotherapy is one of the cause for having the uric acid deposition. Also diabetics patient, I don't know, for some reason they have a lot of uric acid problem, uric acid deposition. So this chemotherapy cause maybe renal damage or cause the nuclear catabolism is breaking down to contribute increase serum uric acid levels. So I didn't know these side effects of the chemotherapy. I know the other side effects. I didn't know about these side effects. So plasma
Ma'am,
levels, yes.
I have a question, ma'am, regarding the uric acid. What happens if there will be accumulation of the uric acid crystals in the kidneys and nothing is done? No medications are, and will it result to a renal failure, a chronic renal failure?
It's going to be painful, obviously. It's going to be abstract, the total things.
Yeah.
Yeah. If it is cannot be, then they do the lot of fluids and other things, try to dilute it, and so and then try to give it some medication which can break down the uric acid crystals
What
to
about if
simpler
it's,
forms.
yes, ma'am. What about if it's untreated, meaning nothing?
Oh, if
Will
you
it?
untreated, generally if there is uric acid, you will feel pain and this and that. Then you have to go to the doctor, and doctor will see you and give you the medication
Yeah.
so that the uric acid can be break down. So sometimes you feel the pain and the redness in the ear, sometimes the joints, you go to the doctor. If you go to the kidney, generally it cannot stay like that, but it's going to be accumulated, then it's going to block the
Yes.
capillaries, the knot of the capillaries, the glomerulus, and it's going to be a
Mhm.
lot of pain. And then they have to do the maximum fluid or some medication or the drugs which can break down the uric acid.
Right.
Yeah.
Thank you, ma'am.
Yeah, it's okay. Yeah. So uric acid are higher in males than in females. That's a normal, okay? Plasma urate is completely filterable. So it can be go for proximal tubular tubule. So if the kidney is functioning, it can be nicely go past filter and go to your excretion. But renal failure, plasma uric acid level progressively increases. And with progressive renal failure, uric acid is retained. It's going to stay in your body. So it's going to be more higher and higher and higher concentration. Oh, more. Oof. Oh, so these are the reference range for you guys. Creatinine 50 to 120 microliter, micromole per liter. Urea 2.5 to 8 point. Maximum is millimole per liter, micro per milliliter. It's not impossible to remember. Just remember a couple of things I told you guys. So GFR. So these are the all things, and how you are going to care for your kidneys. See your doctor for regular checkup. Manage your diabetes. Have a healthy blood pressure. Know your family kidney history for sure. Take medication as prescribed. Stop smoking. Stop alcohol. Be active. Aim for healthy weight. Eat healthy. That is for. Yay, done. Unit 3. Try to make it as concise as possible. If you guys think I missed something, please excuse me. I try to. It's already overburdened to you guys. It's already overburdened. I can tell you.
Thank you,
So
Miss.
no, I try to make as concise as possible, whatever is the main things. But yeah, I give you the reviews. You have now your D12, everything. Now I think I can leave you guys for your what is called review study.
Review,
Half an
miss, because
hour,
I'm
yeah, rubber,
Yes,
yeah,
ma'am.
yeah, review and study, and
yes.
let us see if you can take the exam tomorrow. Just let me know. You can do them early morning, around 9:30, if you are got ready. So yes, and then we can go from there. Okay?
Yes,
We'll
ma'am.
try, miss. It's a lot of
Yeah,
material.
I know,
So
I know, I know,
Yeah.
I know. That's why I told you you are going to be researchers soon, someday.
I thought, like, miss, I thought that, like, getting almost to the end of it, I thought, okay, it was gonna get easier as we go.
No, no, no. It's going to be more complicated. You will see when you'll
So
go to the
not.
cytology, you are going to the microbiology, you will see. And I don't like the microbiology. You
I
will
have,
see the microbiology. So many to remember. My God.
I might have
Maybe
to
it's
get a
going to be easy
fighting.
part, but I don't like the microbiology. I don't mind the specimen and other things, but plating. But for all these junk things to remember, I don't like it.
Yeah.
Yeah. Okay.
Can only try our best right now,
Yeah.
but it's
So you guys can stop working on your, instead of wasting our time. So you can start working on, you guys, whoever want to join in group. So you guys can join in groups and do the review along with side by side all my notes I send you for your study. Okay. Okay.
Can we just stay online and just do it?
Thank you.
We only have half an
Okay.
hour or 1 hour.
Huh? What is Asna telling?
No, it's saying that can we just stay online and just do it? Because we only have a certain amount of time right now.
Yeah, that's why I give you the try to finish it with concise and give you half an hour times, and you can extend the time to 1:30 to how much you time you can provide. You can
Okay,
complete
thank
your
you.
yeah, you can complete if you have time. If you are okay, you can complete your things. Who wants to? And who wants to do
Thank you,
by
Miss.
themselves is fine also. Whoever wants to join the group, try to group that, be on group and try to do your reviews, complete it. Okay.
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 Thank you,
Yes,
Miss.
ma'am.
Okay. Okay.
Thank
No
you, ma'am.
problem.
Thank you, ma'am.
Okay.
Yes, ma'am.
Okay,
Ma'am,
who's gonna start?
ma'am, can I have a question, please?
Yes.
Yeah, could you please send us PowerPoint highlighted because
That's I told you I cannot save it the highlight PowerPoint. I am doing in the
because
D12. When that time I try to highlight it, and then I cannot save it. D12 make it in such a way that we can. I have to find it later some way how I can do that. But right now it's in the property of the Anderson College. Nobody can change or alter anything.
okay, thank you. Because so much information, you know,
I
we
know,
have
I
to
know, I
after
know. I'll
class.
try.
Yeah,
I'll try. I'll
thank you.
try. If I can take the screenshot or do something, I'll send you. But right now, whatever I give you, all the reviews for the study, that is going to be helpful a lot. Okay, so go to the study also.
Thanks, mom.
Miss Moon Moon,
Yes.
I still don't have my chemistry unit on D2L. I'm missing all of the information and I've emailed them twice and there's no response.
Maybe that's why I wrote to email that you didn't complete the math, quality and math. So maybe they are not going to move you to there. You are not supposed to move to the next module until you finish the previous module.
Well, because all of the other units are there except for the chemistry. So I have
Oh,
everything
really?
analysis.
Oh, okay,
Yeah.
okay, okay. So I don't know. That's the IT department. Can you send
Yeah.
forward the email? I don't know whether you have to send it to the D12. Well, one time, Benton, you send the email to whatever send you email the IT. IT didn't give you any response.
No, nothing.
Can you forward that email to me?
Sure. Yes. I will forward it to you right now. Hold on.
Okay. You are driving and doing all these things, Kara?
Miss, I also want to comment something. I
Yes.
also asked the IT department for help so they can pass the Authenticator app onto my new phone. And they said they were going to send me a message and they haven't sent it yet. And I talked to the guy in person. So,
Did you talk
yeah.
to the guy in person?
Yeah, I talked to the IT guy in person. I asked him, how do I
Okay.
switch?
So did you send the email to?
No, he's like, okay, give me your email, give me your phone number. I'll send you a message. I've been waiting for it. He hasn't sent me nothing.
Okay, dear. Send an email with all the
Yeah.
references, what you have, forward to me. I'm going to forward to the IT and also the Brenton. That only I can do. I'm not the IB specialist, but I can help
All
you
right,
guys
no,
in
it's all
that
good,
way.
miss. I just want to let
No,
you
no, no.
know
If
that
you need
this.
it, just write an email to IT again that you told me this. Till now, I didn't get it. Whatever the discussions and happened with you, which day, and what you asked for, till now you didn't get this one. So just write an email to IT and CC to me.
Perfect. Thank you, miss.
Hello guys. Just to let you know that in D2L there is a printing and downloading is now available for students.
Oh, really?
Yeah, in the notification.
Very good. Very good.
What
It's about
you can download? The PowerPoint?
Yes. Yeah, the material I think.
That's
Yes,
good.
couldn't download, right? Could not download, right?
Yeah, at
Alice?
first we could not download anything from there. Like we couldn't print anything. So now they
wow.
put
Yeah,
it
they
back
just
on.
they just posted 22 minutes ago.
Okay, good. Thank you so much.
Oh, that's
Appreciate
So
it.
now
great.
they mean that means I can also download. You guys can download means I can download too.
Yes.
Yes.
Where is posted?
Maybe
In
in
the
that.
D2L, ma'am, in notification.
Outlook.
In Outlook or D2L?
Outlook, mom.
Let me see. No, I didn't get any.
Indeed. Was it in no? And the where is it?
Just go to your D2L and
Oh
then there's
yes,
a
printing and
notification there.
downloading is now available for student. It was just posted at 12 p.m. Gabriel,
Thank you for the heads up, Maurice.
thank you, appreciate that.
Welcome.
What is where? I didn't get that email. From where you
Go,
got the email?
go to your D2 helmets at the main page, like home.
Okay, just give me a second. Okay.
Yeah.
Just give me a second. Okay, so oh, what is this?
Same
Okay.
place that you were teaching us from, and then you just
Yeah,
scroll
just
down.
give me a second, sweethearts. Give me a
Take your
second.
time.
Okay, so okay, what is this one? This on the main page. And on the main page, where I'll go?
Just scroll down where you see welcome, and then you scroll down and you will see like your name, the teacher
Welcome.
name. Yeah, go down and then you will see the printing and downloading on the main page.
I am
Like home.
okay. I am sharing with you guys the share. Okay, so this is my own page.
Okay, let me see what you're yes.
This
Okay,
one?
go. Oh no. Go. I think you have to go back one more, or just touch my home.
Yeah, Miss. My site is go my home.
My home.
Yes,
Up,
ma'am.
good. There you go. Go down now.
Yes,
Go down.
go
And
down.
there you go. Here. It's here.
Oh, only for students?
No, it's well, I don't know. Student can now print. I'm sure if we can print, you can print too, miss. Very good.
Okay. Good for you guys.
Yeah.
I don't know whether I can. I will have to try.
Okay. Oh, I'm so overwhelmed right now. I'm tired. Is there anyone wants to start reading?
Yeah, I can start.
Okay, go ahead.
So should we read, like, what should we do? Should we take turns? Should we,
You
like,
can
should I
call
read a
names.
whole page, or
You can call names.
we call
Yeah, you
names when we're
can.
done?
We don't have that time much,
Yeah.
Christiana.
Okay, so okay, go through it. Go through it then.
Yes.
Okay, no problem.
Okay. I wrote them down, so just in case if I'm missing some questions, maybe
We're
you guys
here
can help me out.
because I don't finish all
Um,
of mine, but we are here to help.
yeah, okay. So the term used to break down the red blood cells, should I read just the A, B? You want me to just read the answers?
Just the answers.
Okay.
I think.
So the first one, number 1, I got D,
Yes,
hemolysis.
that's what I
Okay.
have.
Yes.
Second one, D, 120 days.
Yes,
Yeah.
Yes.
Okay. Third one is B, GTT.
that's right.
Yes.
Okay. Fourth, I got false.
I did false too, but not sure.
I wasn't sure
I
about
think
that
this
one.
is
I
discrete.
got
It's true. There's only
through.
one.
I got through.
It's BA1C only, so it's
I put
true.
through and I
Yes.
crossed it out because I wasn't sure.
Yeah.
I said 3 months.
It's
Because
true.
because it said no, because it said patients, because with the discrete, it's just for individual, right?
Yes.
Check patient 3 months average. So in 3 months time, it will be HbA1c only that will be tested. So that's just one test is discrete, I think.
Yes, mine is true too.
Okay.
Yeah.
Okay.
So
So I was
true is
wrong.
the
We can
answer.
ask mom.
True. Yeah, it's true.
It's true.
Yes,
Okay.
we said it's true.
No problem. I'll put a question mark just in case if we want to ask her.
Because I had
Okay.
true
Yes.
before, but when I see patients and I see discrete, it's only one, like an individual. That's why.
Yeah.
Mhm.
Okay, keep going. So
Okay.
it's
Next
true.
one.
Okay.
D, osmolality.
Yes,
Yes.
it's D.
Osmolality.
Yeah.
D. Yep. Next one is sodium fluoride. C.
Yeah.
Yes.
Okay. The next one is A, fasting blood.
Hold on. For the sodium fluoride, got that. But doesn't the potassium acid is in the same tube too with the grade?
Yes, it's in the same tube, but I believe that potassium
Anticoagulant.
is the
Right.
anticoagulant,
Got
That's
it.
and
right.
then the sodium is the preservative, right?
Okay.
Yes.
Okay, good. Yeah, I see. Oh, the preservative. I didn't even see that. Thank you.
Yeah.
Okay, go ahead. Just want to
Okay.
understand it while I'm going. Yeah. Mhm.
No problem. And then the next one is A, fasting blood glucose.
Yes.
Yeah,
That's it.
Okay.
that's right.
Next one is A, 1 hour following the glucose drink.
Right.
Um,
Yes.
Yes,
Yes.
because it's a glucose test.
Yes,
Okay.
glucose test. And it even says it in the question, 1 hour PC.
Yeah.
Yeah. Okay. The next one is D, serum and
But
collected.
PC does not mean the drink. Remember,
After a
PC
meal.
is
right.
after a meal.
After a
It's
Yes,
meal.
after the meal.
PC is after a meal, but the question said glucose test.
Exactly.
Yeah.
1 hour following a meal, isn't it?
Yes.
It's supposed to be after a meal in general, but the question said after 1 hour PC glucose test.
Mm-hmm.
I thought I read that 1 hour following the meal, but I put a question mark. So you guys are saying A?
For
Following
me,
the
Yeah.
I say for me.
Yeah, for me, I said A, but it is
For me
contradicting.
too. Yeah, but we can ask mom.
Okay.
Miss,
No,
can we
ma'am
explain
is, ma'am is not going to give any answer.
Miss, Miss, can you explain this to us, please? Because I
No,
think
no, I already did. I am not going to do that.
okay. All right.
What
thank
is
you.
tell? What is said? What is the question?
It says 1 hour PC glucose test means test is to be done.
Hmm.
A is 1 hour following the glucose drink. B is after fasting for 2 hours. C, 1 hour before a meal. The last one is 1 hour following a meal.
To me, it was like 1 hour following a meal. It didn't say
That's what
the
I
Yep,
read.
that's what I
oral
put.
Yes.
That's what I
OGDT. I
read.
don't know the
Yes, that's
D12. I don't know the
That's what I
D12.
read, though. I think
Yeah,
that's what
but
I
for
Okay.
read because
me, if it is the OGTT test, then I can see glucose tolerance test. That in me is in the after following the glucose drink. But for me, is more things is 1 hour following PC, right? So after a following PC means post meal actually.
Post meal.
Whatever,
Yes,
Okay.
yeah, that is my thinking. I don't know your D12.
Yes, but
I think that's
it
right.
says 1 hour PC glucose test, Ms. Mama.
Yeah, but the glucose test is the drink, right?
No.
So
For
is it 1
fasting,
hour?
listen, for fasting, for glucose, for diabetes, what you test you does? Glucose test? Fasting glucose, random glucose, PC glucose.
For fasting, it's random. Sorry, it's
There is
fasting.
fasting
For
glucose,
fasting, it's
random glucose.
no,
There is
no.
PC.
Sorry?
Listen to me. You can do random. What are different types of glucose test you can do? You can do random anytime.
Yeah.
You can do fasting,
Fasting.
where you are
GTT.
fasting 8 to 10 hours.
Yeah.
And you can do the PC, right?
Yes,
After
ma'am.
the meal. After the meal. Okay.
Yep.
So these are all glucose tests.
Okay.
Yeah, because there was in D12 there was also an example. They said they give an example of 2 hours, and then the answer was after the 2 hours of the meal, after
This
2 hours after a
this
meal.
question is confusing itself.
Yes.
But as per the question, whatever my answer is following a meal, it may be 1 hour following a glucose drink as per D12. I
Yeah,
have no idea. I have no idea.
that's what D12 said though.
Yeah.
1 hour
That's what I
following the
see.
glucose drink?
Yes, I know I read it.
Okay, so then it's going to be the right
I
answer.
looked it up though.
Then they follow, if it is in the D12, follow that one.
Yeah,
Yeah.
it was in the D12.
Okay, okay.
Keep going, guys. When I find it,
Okay.
I'll read to you.
It is really, it should be the OGTT test. It doesn't say the PC. But anyway, if it is say the PC, after glucose test, you can do the following the glucose drink. Okay, we'll
Yes.
see how it comes in the D12. Yeah, I don't know.
Okay.
For me, it's confusing question.
That's
Yeah.
true. That's true, ma'am.
Okay. So the
Okay, here we
next,
go. Here we go. I think this is it. I think so. Type of blood specimens, PC.
Oh, just one thing to just let you guys know, I got an email from Badil from Monday. Don't put anything in that the next to the room to us. You know where you put your bags, this, that. You put in the lockers. You bring the lock or something like that in the lounge, staff lounge, where you eat. You put everything there. Nothing should be put because he is going to take class there. Okay.
Okay, ma'am.
No,
okay.
nobody is going to be there. Nothing is going to be there. So go straight to the lunchroom and put it there. Okay. Before I forget.
Okay.
Sorry.
Okay.
No.
Thanks. Asna, you wanted to say something or can I
Yeah,
continue?
so it said on page 45 of unit 2, it said that for PC can be 1 or 2 hours PC. So PC equal after a meal,
Yes.
okay?
Okay.
Not a glucose drink.
That's
Okay.
right.
Not a, it's after a meal, but it's not a glucose. So I think that's right.
Yes.
And there was
Yes.
another example. I'm just trying to find that. But go ahead.
So
Okay.
letter D is the possible answer, eh?
Yes,
Yeah.
Yes.
that's why Mom was saying it's not the GPTT.
Yeah.
Yeah.
Okay.
So it's PC. It's not GPTT.
Right.
That's,
Yes. Okay. So it'll be D. Okay.
Yeah.
So the next one also is D, serum and clotted red blood cells.
That's what
Yeah.
Did you
Yes.
guys? Yep. Okay.
Yeah.
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 The next one is A,
Yeah.
Yeah.
Yes.
Jeffrey reaction. Okay. The next one is false.
I have true.
True.
You have true.
True.
Yes, true.
Okay. Okay.
Because it's
Next, remove the serum
falsely decrease the value.
from an after to ensure.
Okay. If you guys have true, then
sustained
it's
life.
true. Maybe I'm wrong. Okay.
Yes, true.
The next one, I put true
Yes. I have
Mm.
true too.
for Mario.
I have
False.
true.
You mean the
It's false for
myocardial?
me.
Myocardial? You mean it's talking about which one?
Yeah, myocardial infection is
It's false.
It's
false.
the only condition
False.
that can elevate troponin. No, muscle damage also will
Okay, so it's false.
increase troponin levels.
Yeah, it's
Okay.
false.
It's the only.
The answer actually it's just
Oh
underneath.
no, CKMB also, just like we have discussed today, will also
can-
increase in myocardial infarction.
You can check the answer below. There
Yeah,
is,
the answer is
increase
just
the
under
troponin
the
level.
question.
Yes.
You have the answer just underneath it.
Oh, the answer is okay. So it's
You guys are
false.
smart.
That's the example of the,
Yeah.
yeah.
Okay, so false, right?
Yes.
Okay. The next one I put. Oh, this is a fill in the blank. So I put elevated level of. Is it trophin?
Troponin.
Troponin. Yeah.
Troponin. Yeah.
Mhm.
Did you guys get that one too?
Yeah, my answer is increase in troponin level. It's the same.
Yes.
Okay. Okay. All right. So the next one is B.
It's
The
B.
specimen
Yeah.
is
Yeah.
transported in ice slurry
Yes.
down. Yeah.
Yes. Yeah.
Right.
Okay. So that's B. The next one is A, 7.35
Yes.
to
Yeah.
7.45.
The first answer.
Yeah.
Yeah.
You're right.
Okay. The next one, it says, what are the serum separated tubes? Okay, so it says select all that apply. I selected gold and orange. Am I correct?
And red.
Mint and
I
red.
have red too.
And
Gold,
red, right?
gold, red, and orange.
Yes, gold, red, and orange. Okay.
Hello, Miss Moonmoon. Sorry, guys, to interrupt. Hello, Miss Moonmoon. Can I leave now? I have a dental appointment at 1 o'clock.
For me, it's okay. My class is done.
Yeah.
You guys can do your homework or review and anything at your own choice.
Yes, ma'am. I already answered all mine. So,
Okay.
okay. Thank
Good for
you.
you, girl.
Yes. Okay. See you, Berna.
Bye, guys.
See you,
Okay, see
Berna.
you.
Take care.
Bye.
Thank you.
Take care, Vanna.
Okay. The next one is D, Na plus, so that's sodium.
Yes.
Okay. Next one, B,
Yes.
BNP, B type. Okay. The next one, this is also fill in the blanks. It's fast for 8 to 10 hours.
Yeah.
Already answer's already
Yeah,
there.
the answer already.
Okay, it's there. Okay. This one also fill in the blank. I said application of tourniquet.
Yes. That's
Yes.
my answer too.
Okay. The next one is within 4 hours of collecting.
Yeah.
Yeah, that's true. Maybe this one is true or false.
The answer was
Yeah.
already there.
I have answered true. Yeah.
Okay.
It's supposed
The
to be
next,
2 hours, actually.
Yeah.
Right?
Right.
I think this is true or false.
Yeah.
oh, it's a true or false one?
Yeah.
It's true.
It's true because I can never tell when it's true and false because we didn't see. So this is
That's
true.
right. If the question is true or false, it's true.
It's
Okay.
2 hours though, right? It's not 4 hours. It's 2 hours supposed to
Yeah,
be.
but I think the CLSI mandate is within 4 hours.
4 hours. Yeah.
Yeah, CLSI.
Yeah.
So
Even
it
in
could be
even
it
in
could be
D2L.
any other question regarding this.
Yeah.
Next.
Okay. So the next one is D, hyperglycemia.
Hyperglycemia.
Yeah. Okay. The next one is a fill in the blank. I put increased concentrations,
Yes.
right?
Yes.
False
That's
increase
my also my
concentration.
answer, increase.
Yes, can falsely increase concentrations.
That's right.
Okay. The next one is B,
Yes.
transfer and
Yeah.
respin
That's what I have. Yeah.
slash aliquot. Okay. Let's see.
Common label.
Okay. So let's see the next one. Oh, I don't think I have this one. What is the common label used? I think this is the
Alkaline.
This is
the alkaline, right?
D. I
Alkaline
put the last
phosphate.
one. D.
Alkaline.
Yeah,
Put the last
alkaline.
one.
Yes,
Alkaline.
alkaline phosphatase.
Okay.
That's my answer
Phosphate.
too.
Yeah.
Okay. The next one is A, uric acid.
Yes.
Yes.
Yeah.
Yep.
Okay. The next one is D, GFR,
Yes.
Yeah.
gallmeter
Yes.
filtration rate. Okay.
Great. Yeah. Mm-hmm.
Yeah.
The next one is C, quality control testing is cut in
That's
half.
right.
Yes.
Yes.
Okay.
Yeah.
Next one is C.
Yes.
Yeah.
Yes.
I can
Eliza.
never pronounce this.
Eliza.
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 Yes. Enzyme links. Yes. Okay. Next one is A. High or
High
low
and low.
values.
That's
Yes.
right.
Okay. Next one is B. The amount of light that passes through the colored solution.
Yes.
That's what I have. Yeah.
That's for me.
B. Okay. Next one is A.
Yes.
Photometry.
Photometry. Yes.
Yes. The next one is C. 7%.
Yeah.
Yes.
Less than 7.
Okay, less than 7. Yes.
Yeah.
Less than 7%. Okay. Primary symptoms of diabetes. So this one, I think is also select that apply, right?
Yeah, I guess so.
So
Because I
I
have more
put,
than one answer in this one.
yes, I think it's more than one answer. So I put B, C, and D.
Exactly. Yeah, I had the same. The same. B, C, and D.
Yeah, the presence of glucose in the urine, increased hunger is C, and also what is it, polyuria, increased urination.
This one is quite confusing for me. Asking about the symptoms.
Yeah.
The output. Yeah.
Depends on.
Not that we can see in the lab.
Yeah. For D2L, it mentioned all those three: B, C, and D.
Yes.
Yeah.
Yes.
Okay.
I checked it. I said
Yeah.
B, C, and D.
Thank you.
Yeah.
I have C and D only.
Oh.
The three P's actually. Polyphagia, polyuria, and polydyspnea. Something like excessive hunger.
Excessive hunger, yes.
Yeah.
Yes.
Okay.
So the next one, if needed, blood can be drawn from the IV line after IV is shut off for a minimum of, so D12 says 2 minutes, but
Right.
I believe it's 5 to 10 minutes.
CLSI is 5 minutes. Yeah. 5 to 10
Yeah.
minutes.
I added 5 to 10.
So we don't know which one are we going to follow. D2L maybe? Maybe D2L.
I thought it was 2 minutes.
Yeah, 2 minutes.
Yes, on D12
minimum.
it says 2 minutes. You're right. So I guess if we see 2 minutes, you pick the 2 minutes.
Exactly, because it's D12.
Yes, because it's D12.
What is Miss Mumu saying?
Miss Mumun yesterday said it depends. Because 2 minutes is not really realistic, right? If you're doing it.
We will follow the D2L.
Yeah.
And the D2L said 2 minutes.
Somebody really needs to go through D2L and fix it. Because it's ridiculous. They should get like an MLT to rewrite it. Because all of this excessive crap, it's just, it's nonsense.
Yeah.
And then you're told one thing and told another.
That's true.
Yeah.
That's true.
Yeah, I remember once when Miss China said that in the ML question, she had it in the ML and there was no 2 minutes in the options. That was only 10 minutes. Yeah.
Yes.
Is 5.
Yes.
Yeah.
She said there was no 2 minutes in the multiple choice questions. So the closest one was 10 minutes.
10 minutes. Yeah.
Yes.
Yeah.
Remember that. So
But
2 or
this
10
one,
minutes.
I think it has to do with grammar. It says minimum. It didn't say you can have a minimum range and you can have a maximum range.
Yeah.
So the least minimum amount of time you can wait is 2 minutes. It's just grammar. So if I believe maybe if there was an emergency or something, so you can wait at least 2 minutes, but it is the maximum that you can be going forward because you need the blood to circulate for the intravenous fluid to move away. Then you can wait 10 minutes, 5 minutes, 10 minutes.
But the IV for the IV
minimum time.
Okay.
Yes, ma'am.
For the IV, as per dual is 2 minutes, but in reality, it should be 5 to 10 minutes.
Yes.
In reality, 5 to 10 minutes, your D12 2 minutes.
Yes, ma'am.
Yeah. Okay, miss.
Which one do we go with? Which one do we
follow
go with?
D2L.
For
D12.
giving the answer, here you are going to follow the D12.
That's
Yes.
And for
Okay.
in real practice,
That's what I had. 2
generally you
months.
have to
Okay.
do less. You doesn't have to take the blood from the IV, but in real practice, you have to give 5 minutes because that the medication and these and then everything is going through the IV.
They should be
Okay.
teaching us in
Huh?
real life.
Huh?
Yeah.
They should be teaching us in real life. The material
Real
they're
life.
giving us
Because
is very
I'm in
misleading.
hospital. Otherwise, if I'm not work in hospital, I cannot teach you these things.
No,
But
I
I'm
would love to
teaching you
know
a lot as I'm working in the hospital.
Experience, mom. Eh?
who is responsible for making D2L, for building it.
Not me.
I know. Because if you were responsible, we would be great.
You guys can write that one. There are a lot of misinformation in the D2L. You can
A
write
lot.
it. Yeah.
It's true.
True.
My
Okay.
God.
Okay, I'll read the next one. So hemolysis can falsely increase
And
plasma
also don't
K.
write Moon told us to write it. Don't write it that. That Moon
No,
told
no,
us
no.
to write it there. They're going to what you are doing instead of working for the Anderson College, you are telling the students. Okay.
No.
Okay, so for the next one, the fill in the blank, I put increase.
Wait a minute.
Oh,
Yeah.
sorry.
So answer is increased.
Yes.
Yes,
Increase winners.
increase.
Thank you.
Okay. The next one, I put C, autoimmune, destruction.
Yeah.
Yes,
It's the
it is.
only autoimmune. Yeah.
Yes.
Yes.
Destruction of the pancreatic beta cells. Okay. Next one, I put C. I'm not too sure about this one.
For me, it's C as well.
It's
C.
Yeah,
C,
me too.
clean
C
finger
also.
before each test,
Yes.
because it's not part of the quality assurance
That's
activity,
right.
right?
That's right. I
Right.
looked that up too.
Yeah.
Yeah.
Everything
Okay.
else was right. This was the only one that was not there.
Yes, that's true.
Yes.
I see that.
Yes. You're right.
Oh, in D2L.
Yeah, in D2L. Yeah,
Thank
all of them.
you.
Yeah, and all of them are mentioned except for this one.
Yeah.
Yeah.
Yes. Okay. So the next one, chemistry test is most effective by red books. Okay, so this one is B, potassium.
Yeah.
Yes.
Yep.
Okay.
That was a guess for
Um,
me. I got it.
Next one is also a fill in the blank. I put due to can never say this.
Hemolyze.
Yeah,
Hemolyze.
hemolyzed
Hemolyzed.
samples.
Yeah.
So that's hemolyzed samples. The next one, I put dark yellow. This one is for the bilirubin.
Mm-hmm.
Yes.
The next blank. Okay. The next one, I don't have that blank.
It's
So
the HIS. My
Yeah,
answer is
human
HIS.
computer
His.
interaction.
okay.
Yeah, his. What's the
HIS.
HIS.
What is that again?
HIS?
His.
Extensive
Okay, so it stands
information.
for human.
Computer interaction. HCI.
Human computer interaction.
Oh,
Winners?
okay.
Or HIS?
HIS, right? HIS.
Right.
HCI.
Thank
HIS.
you. Thank
Yeah.
you, guys.
Okay.
You're welcome.
Thank you.
Human computer.
Yep.
It must be
Interaction.
human information system.
Yeah.
Yeah, because
Information
it's
system.
HIS.
Yes.
Yeah,
Human
HIS.
Yes.
information
Information
system.
system,
Yeah.
right?
Yes.
Yeah, we discussed yesterday.
Yeah, it's
Yes.
So,
We discussed it yesterday.
so it is HCIS.
no
HIS only.
HIS, human
HIS.
information
It's his.
system.
So
His.
HIS.
Information
Yeah.
system.
According to
Yeah.
D2L Binash,
His and Liz.
his and yes, ma'am, his and Liz.
Yes.
Oh,
Yeah.
yes. His
Yes,
and
I
Liz.
thought it's the LIS actually. It's
Yes.
Yes.
LIS.
Yeah, Mom said it yesterday. It's two computers.
So
I just remember.
his and what? What's the other one?
Mm.
Liz.
Liz, lab
IS.
One is
information
laboratory
system.
Laboratory
information
information.
system, and another is the demography. Sees when the two
So
computers talk each
Yes.
other.
They're both is an exchange of information between the computer and the user. Is an
Yeah.
Liz? Okay, so they're
Yes,
both.
and Liz. Okay, ma'am.
Yeah, that's
Thanks.
what she's saying. Is and Liz. So Liz is the lab information system, right?
Right.
Yes.
Yes. Okay. So the next one, the blank, I got, so it says blood should be collected and stored in a way that is protected from light. I got bilirubin.
Yes.
Yes.
Okay. Okay, this one is match the disease and the disorder. So GTT, I got, that was for number 1.
Yes.
Yeah.
Okay.
Diabetes mellitus.
Aeon gap, I got 4.
Yes, you're
Yes.
right.
Yeah.
That's right.
Acidosis.
For CTNT, I got number 2. So
Yes,
yeah,
you're right.
Myocardial.
yeah,
Yeah.
cardiac, yeah. The next one, glucose, I got 5.
Yeah. Diabetic ketoacidosis.
Yes.
5
and
for
then,
that?
Yes. Diabetic ketoacidosis.
And then creatine, I got 3, kidney disease.
Yes.
Yes.
That's right.
Okay. So the next
Yeah.
one, this one I didn't really know, but I thought it was the C, radioactive protein.
Yes, it's C.
Yes.
Okay.
Yeah, it's for protein.
Okay. This one, the measurement of waste products. Oh, that would be C, creatine. Creatine.
Nin.
So it's C.
Protein renal test.
Is it D?
Waste product of protein. My answer is
Creatine.
D. Urea.
D. Yeah, that's
Yeah,
what I have.
D.
Urea.
Yeah, because it mentions the protein metabolism renal test, so it's urea.
Oh,
Yeah.
urea. Okay.
Yeah.
So
I'm not sure.
Yep.
Sure.
I think
I
that's
have
right. That's what I have.
Yeah.
I don't know for anyone else. But I think I read it somewhere. I know that I read this.
Because
Okay.
it says waste product of protein.
Urea is the end product of the metabolism of protein, so it's urea.
Protein. Yeah.
urea.
It's
Okay.
urea. And
Urea.
product of protein metabolism.
Yeah.
Okay.
So it's B.
Letter D.
Letter D.
Letter D.
Daddy.
Urea.
Urea, yeah.
Yeah.
Oh, urea. Oh, thanks.
Urea.
Thanks.
Okay.
Urea.
Thank you, guys. The next one I got was C,
Yes.
Yeah.
CFR.
Yeah, GFR.
Okay. The next one, glucose drink. So this one I got B, 75 grams.
Actually, this one is quite conflicting with mom yesterday. She was mentioning about 75 grams in D2L and 50 grams is only administered.
Oh.
Yeah, she discussed this yesterday.
Oh, yes.
Yeah.
I saw the 75 in D12. What are we going with?
Yeah, I found 75 at D12 too.
Actually, I find it 50 in D12.
Oh.
There was, I think that it's mentioned 75 in D2L, and between two brackets, it says clearly like not for pregnant.
Yes.
Right? I remember something like that. I'm not sure, but I'll double check with this one.
Okay, we can double check with that one.
Yeah.
So it's either 50 or 75. Okay.
So 75 glucose drink, male or non-pregnant female? Non-pregnant female, it's 75, not pregnant.
I'm sorry, where are we now?
We are...
We're talking about which glucose drink is given to a pregnant woman.
So the pregnant woman get 50, right? Get 50 grams.
No, I think it's 75 for pregnant.
I see non-pregnant for 75. I see 75 gram glucose drink, male.
Yeah, for pregnant, 75.
Non-pregnant female.
Yes, I remember that. I read it yesterday between two brackets. I put it between two brackets that male and non-pregnant. And when pregnant, not supposed to have 75. They're supposed to have 50 grams.
50?
But I don't
In
I don't
slide
see 50.
47, unit 2, slide 47.
Okay, we can double check this, I guess, because I thought I seen 75, but we can double check
75 is non-pregnant.
non-pregnant. Okay.
But the screen for the GDM at 24 to 28 weeks during 28 weeks using a 75 dose of the.
Yeah.
This is confusing because
It
here it is
is.
again. It's saying that when they're screening at the 24 to 28 weeks using a
Yes.
75-gram doses of. It's there. It's 75. So one is
so we
saying
can
that non-pregnant.
we can quick question mark.
Yes, question mark on that one.
Yeah, because one is saying non-pregnant and one is saying that when
We have
you're
lots of questions.
Okay, go ahead. Go ahead.
Okay, so that the next one, D.
Yeah.
Yes.
Total.
Yes.
Okay.
Most sensitive.
This one is also a fill in the blank.
Yeah.
I didn't have this one.
Pneumatic tube is my answer.
Pneumatic tube system?
Yeah.
Yes.
Okay. I guessed that one. Okay.
Pneumatic. Okay, it's N.
Yeah.
Sorry.
Pneumatic.
PN.
PNEUMATIC tube system.
Yes.
Okay. Next one is D, electrolytes.
Electrolytes.
Yes.
Okay. The next one is D, water.
Yes.
Yes.
Okay. The next one is B, approximately 400 nm to 700.
To 700.
Okay. The next one, I believe, is B.
Yes.
Yeah.
Okay.
Yeah. T and CTN.
B, yeah. CTN. Okay. All right. This one is also a fill in the blank. I thought it was GFR.
Yes. Yes.
True.
That's what I have.
It's minute.
Okay. Next one is D, 280 to.
No, it's C.
Oh, C? Uh-oh.
No,
Yeah.
no, it's the last one.
Today,
No,
The last one.
no.
The last one is D.
The last one because it's per kg, not per
Yes.
kg.
MOSM per kg.
Yeah,
Yes,
what's your
kg.
Right.
Yes,
Discussed
not
today.
millimeter.
Yeah.
Yes, exactly.
Yeah, I know that for sure. I saw
Molality.
that in D2 for sure.
Yes, so it's D.
Yes, D.
D.
Okay. This one is also a fill in the blank. I said stored. So serum and plasma is tested within 2 hours of collection and will be stored at room temperature.
Yes.
Yes.
Okay.
It's
This
2 to 8 degrees Celsius.
Yes.
Yes.
The next one.
The next one's 2 to 8 degrees Celsius.
Testing to be delayed. Yeah.
Yes. Or like you could say refrigerator temperature, right?
Yes.
Yes. The next one I do not have.
My answer is creatinine.
My answer is creatinine as well.
Creatinine.
Statins.
Yeah.
Super
Okay.
Which one
marker
of them?
tool. Yeah.
CREATIN.
Yes.
Yeah.
NINE.
Yeah. Screening for GFR. Glomerular
Okay.
filtration rate.
Yeah. Okay.
Yeah.
Okay.
Creatinine is my answer.
All right. The next one is C, liver.
Yeah.
Liver,
That's
yes.
correct. Yeah.
Okay. The next one is A, when
Yes.
lipids are used as a source of energy rather than glucose. Okay.
Yes. That's
Cause
right.
the production of ketone bodies.
Yes. Okay. The next one is D, prolonged diarrhea or vomiting.
Yeah. That's my answer too.
I think it's because it's like due to like the loss of water, right, in the body.
That's what Miss said. She was talking about it this morning.
Yes, she
too.
talked about it this morning.
Yes.
Yes. Yes, she said it. Okay, the next one is discrete. I'm not too sure if this is right.
It's lipid profile. It's metabolic.
Metabolic. It's
Oh,
metabolic.
metabolic. Shoot.
Yeah.
Metabolic.
Okay.
It's not one single test.
Yeah, it's
Yes.
not a single.
Okay. All right. The next one is B, age and weight of the patient.
Letter C.
C. It's
Height
Oh,
height
and
and
weight.
weight.
so letter
We dis-
C. Oh,
yeah,
Yes.
we discussed this today.
Yes.
okay. All right. So this one says, who can collect a blood sample, select all that apply? I think it's everyone, right? So
Everyone but the
Patients
patients.
not
It's
Everyone
the
but
Patient
yeah.
needs
patients.
to.
the patients
Everyone.
can, like, what about diabetic patients?
No,
Can't
but
they?
that's no.
Like, when you like test for like your blood sugar, like your
But they're
own blood
not
sugar.
collecting though. But they're not collecting. They're testing.
Collection. Yeah, it says collection, Christiana.
Okay, have to be careful.
So
They're
it's
Okay.
just
testing
the
themselves, but they're
patient.
not collecting.
Yeah.
So the patient cannot, but the MLT, the nurse and the physician
And the
can.
physicians.
Yes.
Yes.
Okay. Oh, I don't know why my mind was thinking like, diabetic patients collecting their own blood because of their testing, but it's not really collecting, it's just kind of
They're
a
testing.
test.
They're
Testing.
testing
Yeah.
their sugar
Yes.
level. Yeah.
Yes. Okay. So it's A, C, and D. Okay.
That's
Right.
All right. The next one, I believe, is the metabolic panel? Question mark, kind of. I wasn't
Discrete.
sure.
I would say discrete because
Uh,
it's
Discrete.
only for the
discrete,
prostate.
individual, right?
Antigen. Yeah.
It's a
Individual
lab test
testing.
request
Yeah.
for the
Uh,
PSA blood work.
okay.
Yes.
I was wrong there.
Yeah, it's only for the
Yeah.
prostate antigen. Antigen.
Okay.
Okay, so the next one, cardiac profile, is discrete.
Metabolic.
metabolic.
Ah,
Yeah,
metabolic.
metabolic.
Explain all of those. Okay, we're mixing up.
Yeah.
I think I have to study the metabolic panel and the discrete again
Yes.
because
Yeah.
I'm mixing all of them up.
Yeah.
Okay, so that was metabolic.
Discrete, I think is individual. The
Just
metabolic
one.
is
One test
Yes.
Just
only.
one
yeah,
test. And
and then
metabolic panel
it's
is multiple
Multiple.
multiple.
tests.
Yeah,
Yes.
multiple.
Yeah.
Okay.
Next.
Okay, the next one, I got D.
I got D as
Principle
well.
of galvanic.
Yes.
I
Ion
got D.
selective electrode.
Yes, that's
Yeah.
correct.
I got
D.
D.
Yeah.
Yes.
Okay. The next one, the insulin that
Yeah, it's supposed to be both, but the detail
It's
is
in the
mentioned
D to L.
insulin. Yeah,
yes.
yeah, mention insulin in detail.
Okay. Yeah. Okay. Question mark.
Formation is glucagon. Because
Yes.
if you can remember gluconeogenesis, that is glucagon. Insulin is to take away, to take it out of the blood system. Bringing it back is glucagon.
Oh, I got from the D2, it says glucose formation is regulated by
Gluconeogenesis.
insulin.
That's right.
Yes, in the
Yeah,
D to L.
yeah. The detail
Yes.
I'll mention insulin.
And glucagon is the breakdown
Is the
in the
breakdown.
D
Okay,
to
so they
L.
are mixing it up.
Yes.
What? Glucagon breakdown?
Yeah, in the D to L, ma'am. It says
In the
in the D to
D12, that's
L.
what it says, miss. Is that right?
Glucagon breakdown of glucose?
Yeah, in the D to L.
No,
Glucagon
ma'am.
breakdown of glucose
It's glucose formation, ma'am. It's
is glucose
regulated.
formation. Yes,
Yes.
glucagon helps in the glucose formation. Yeah, that's true. Yeah, okay.
So D to
Ma'am,
L
is
is
it
now
glucagon you are saying or insulin? Because it says formation, and I'm thinking glucagon forms helps in the formation of insulin. Which one? I mean,
No,
glucose. Which one are you saying?
glu
Miss, the question
glucagon forms the glucose.
Okay.
Insulin breaks down the glucose.
Okay.
In detail says the insulin regulate the formation.
Yes.
It regulates, yes.
Regulates the
Yeah.
formation.
It doesn't regulate the formation. It regulates the entry of glucose into the cells. From the blood, insulin regulates the entry of blood glucose from the blood to the cells.
Yes, that's right.
It didn't say that it controls the glucose formation regulation.
Oh, so sorry
So
guys,
the
I'm
answer is
confused. Which is the
glucagon.
answer? So glucose
Glucagon.
formation is regulated by
Glucagon.
glucagon. Okay. Not insulin. Okay.
Yeah.
All right. So the next one I have C.
Yes.
Yeah, I have C also. But I've read it somewhere that it's also stored in the liver.
Yes.
No, C I have.
I have C. Adipose tissue.
Yes.
C. Okay. The next one I have B.
Yeah. Yes.
Okay.
Yes.
This one says, who can collect urine sample? Select all that apply. I believe it's all of them.
Everyone.
Yeah, everyone. Patients.
Mainly the patient. Mainly the patient can collect the urine, but everybody can use it for testing. Only
Okay.
patient. You are not going to collect patient urine. So are you going to go to the private area and collect the urine?
No.
No.
So patient
Mom, what about for those patients who are in with catheter in the hospital?
That's a different issue. That's a different issue. That's a different issue. That's a valid question. Only you can write it down there. Who has the catheter, the nurse, or but you are not going to collect it. Generally, it's the nurse collect it. The catheter, you are not going to use it.
Okay. So patients only. Yeah.
Yes.
So patients. Okay.
As per my knowledge, I don't know the detail.
Yes.
So A is the answer.
I don't know, ma'am.
Okay. So insulin reduces high blood pressure. Oh, sorry. Hold on. Insulin reduces high blood glucose levels by promoting glucose entry into the cells, right? Entry.
Yeah, it's
is
true.
the blank.
It's
Okay,
true.
true.
So entry is the blank. I answered true.
True. Yeah.
Well, I think entry was the answer.
Yeah.
In it. So
Yeah, entry was the answer.
yeah.
Okay, so this one, the blank I put here was for 24 hours.
Yes. That's right.
Say it again. The last one.
24 hours.
24 hours?
24, yeah, 24 hours. Yeah.
24 hours.
Okay. This one I'm not too sure, guys. So
I
have A or B.
It's
A.
I have both.
I
have both. Muscle damage and cardiac damage.
Yes, actually
Muscle
it's both.
damage.
Yeah.
It's both, but
yeah.
in D2L says the muscle damage.
Yeah.
Muscle damage.
Yes. A CK is muscle damage too.
Yeah.
Even is a cardiac muscle damage. So it's a muscle damage for sure.
Yes.
Yes, ma'am. It's also there, ma'am.
That's right.
The both of them are there, ma'am.
The both of them are there.
Both of them.
So I guess whichever comes first.
Well, they said it's select all that.
Select all that apply.
Select that means then you have to select all of them.
Yes,
Oh,
ma'am.
okay. So
Muscle
select
and
all that
cardiac.
apply.
Yes.
Yeah.
No, it said select all that apply. You're saying that we should select all of them?
Yes.
No. All that
No,
apply.
the correct answers.
The
Yeah,
correct
so the
answer.
muscle and the cardiac,
The
A and B, I
cardiac.
think.
Yes.
So it'll be both A and B.
Yeah.
Muscle damage and cardiac damage.
Yes.
Yeah.
But the other question that we passed just now, it did say select all that too, but we only select the patient.
That's the urine.
That's yes. Urine, patients only.
Ashnat is going to go to collect the urine from the patient.
Oh
Yeah.
no. Oh no, they're gonna do that themselves. That's why I'm not a nurse.
Okay, so
so
this
A and
one.
B. A and B. Okay.
Okay, so this one is the match, right?
Much, yeah.
Yeah.
The match. Okay, so the deep vein thrombosis and pulmonary embolism is the blockage in the vein due to clots.
That's right.
Okay. Is this algorithm,
Arrhythmia.
arrhythmia, sorry, is irregular heartbeats.
Yes.
Yeah.
Myocardial infarction is AKA heart attack.
Yes.
Yes.
Okay. Stroke is blockage of blood flow to the brain.
Yes.
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 Angina.
Mhm.
I cannot say that word, guys. I'm trying to. Is chest pain.
Yes.
Yeah.
Yes.
Osteosclerosis is plaque buildup in the arteries.
Right. And
This,
dyspnea.
yes.
Dyspnea.
Dyspnea is shortness of breath, right?
Yes.
Right.
Okay.
Oh, I'm sorry. What is the shortness of breath?
Dyspnea is the last one.
Okay.
Yeah, I know. I
Dyspnea.
have a hard time pronouncing that word too.
I know that's what's coming out.
All of the words for me.
Dyspnea.
Dyspnea. Okay, thank you, miss.
Dyspnea.
Shortness of breath.
Yeah.
Okay. So this one, what is this one? Oh, correct order, right?
Yes.
Correct order, I put C.
C.
I'm not too sure.
It's 4,
C
3,
is
7.
2, 4, 6, 7.
I have B.
4.
You have
Yeah,
B?
it's 4,
4.
3, 7,
Starts with
2,
4.
1, 6,
Light
5.
source.
Yes.
Yeah,
Yeah.
it starts with the light
Light
source.
first.
Yeah.
The light
so
source.
4372165.
Okay,
Yes.
sorry. So it's
Yeah,
B.
always starts with the light source.
Light first.
But I could
Okay.
be wrong. But we have this yesterday.
Yes, that's right. It's 4372165.
Mm-hmm.
Okay. So B.
Yeah.
Thank you.
And
So
it will
breakdown of
end with
glucose.
it will, if we have the question, it will start with the light source and will end in digital display.
And
Yeah, just take note of that. The
Okay.
last one will be the digital display.
Okay. Thank you.
Thank you, Evelyn.
Thank you, Evelyn. Yes. Okay, so this one, the breakdown of glucose is regulated by
This is the one that's
insulin.
Insulin.
Yes.
Yeah.
This is insulin.
Breakdown. Okay, yeah.
Yeah.
Insulin.
Okay.
Yeah.
Glucagon is secreted from the blank. I don't have this one.
Alpha cells.
Alpha cells.
Alpha cells.
Alpha cells and beta cells
And
for
insulin
insulin.
is secreted from the beta cells.
Oh, yes. Alpha cells and okay. Beta cells. Okay.
Yeah, how can we spell it? Okay.
What?
I could sorry. I'll
Sorry, Ying Hong. Were you asking for the blanks?
yeah.
ALPHA. I think ALPHA cells.
Cells, yeah.
And then BETA cells.
Right.
Alpha and beta.
Yes.
Yes, ma'am.
Yeah.
Alpha and beta of the
Yeah, she just
pancreas.
wanted to know how it's spelled, I think.
Yeah,
Yes.
alpha and beta.
Thank you.
Okay. So the next one, the uric acid. The final breakdown product is B.
Yes.
Okay. Next one, major disease. So this one, it says select all that apply. I said B, C, and D.
Yes.
I'm not too sure.
Yeah, I select B, C, and D as well.
Yeah,
Mm-hmm.
I think this Miss Moon was on this today.
Okay.
B, C, and D.
Okay. So the next one, the blank, I put glycolysis
It's
causes
there.
the breakdown of glucose by enzymes to release the energy. Oh, sorry, give me a second.
Pyruvic and the pyruvic. Yeah, that's true. This probably is true or false. The answer is true.
I think it's true.
Yeah.
Glycolysis, right?
Yeah. The uric acid.
Okay, so this one, uric acid levels is higher in females. This will be false. It's higher in
False.
males.
Right.
Yes. I think it's only higher in females when like you reach menopause,
Yes.
but in general, it's false.
Yeah, from the normal range with mom discussed today.
Yes. This one, the level of, okay, so this one I put C.
Yeah, that's my answer too. Yeah, it's BA1C.
Yeah,
2 to
lifespan.
3 months. Yes.
Yep, average blood glucose concentration over the past 2 to 3 months lifespan of RBCs.
That's correct.
Okay.
Yeah.
Okay. The next one, blood sugar levels are less than 3.0 millimoles, causes hypoglycemia.
Yeah, that's my answer too.
That's my blank.
Yeah.
Hypo,
Hypoglycemia.
Yeah,
so
less than 3.
it's HYPO, right?
Yes.
HYPOGLYCEMIA.
Right.
So that's the low one. Yes.
Yes.
Okay, I just want to make sure.
Less than 3.0. Okay, the next one I got was A.
Yes.
Yeah, that's my answer too. The carbon.
90% of carbon dioxide present in the blood is in the form of, yeah, biotin science. Okay, yeah, A.
Yes.
Yes.
Okay, the next one is A.
Caffeine.
Urea.
Urea for me,
Urea.
letter D.
Yeah. Urea for me.
Yeah, A.
Letter D.
D.
Nitrogen, urea.
Yeah, urea.
Okay. The next blank, I'm not too sure with this one, guys, but I put decrease.
Yeah, decrease.
Mm-hmm.
Okay.
Yeah, that's right. We discussed this today, actually.
Okay.
Decrease.
Okay, the next one, I put D. Urea again.
Yes.
Yes.
Okay, the next one is A.
Yes.
Is it A or the last one?
GFR.
Am I wrong?
Glomerular and tubular mass. We're talking about the mass. So I think it's the capabilities of the kidneys, GFR. Filtration capabilities of the kidneys. My answer is also letter A.
Okay.
Oh, the answer is also letter. Okay.
Okay. Next.
I'm not sure.
Okay, so the light transmitted by a solution to determine the concentration of light by absorbing substance in the solution is C.
Yeah, that's my answer too. Spectral.
Spectral.
Yeah, me
Spectral.
too.
Right, yeah.
Yeah.
I'm sorry.
I think Miss spoke about this yesterday.
Yeah.
Yeah.
Okay. The next one is A.
Yes.
Qualitative.
Yeah, that's my answer too.
The next one, I'm not too sure about this one. I have to research more, but I thought it was A.
No, they're talking about the positive and the negative charge. She spoke about it.
Isoelectric.
Yeah.
My answer is D, isoelectric ion. It's
Oh, isoelectric
balance.
ion.
Yeah, it's balance.
Okay.
Yeah, I was between A and the last one actually.
Yeah, me too.
Because it mentioned positive and negative charge, so it's balanced.
Yeah, I just read a little bit about the first one. It says give the same definition, molecule with both positive and negative charge.
That's isoelectric ion, yes, right?
Yeah, the first one. I read a little bit about the first one.
Me
It has the
too.
same. It has
Deuterium.
this.
Yeah, me
It
too.
has
Says-
the
Letter A.
positive. Yeah,
Deuterium.
it has
Mhm.
positive and negative charges on
Yes,
that.
it contains positive and negative charge. I wrote it down here, also known as dipolar ions.
Question mark.
So I could be
Yeah,
wrong.
I
I
was
could be
between
wrong.
A and D actually.
Yeah.
We can, yeah, question mark for that one.
Yeah.
Question mark.
Okay, so the minimum amount of time required to get the results after the specimen has been sampled. This one will be A, turnaround time. So
Yes.
Yes. A.
TAT,
Yeah.
TAT,
That.
Yeah.
Yeah.
A
TAT.
for me.
Okay. What electrolytes is the major? Okay, so this one I put A, sodium.
Yes.
Yes.
Okay. Next one, I'm not too sure, but
Osmolality.
I think it's A.
It's
Yes,
B.
it's I put
A.
A.
Osmolality is the
Sodium
millimoles.
is not a cation. No. Sodium is
Letter
an anion. It's chloride
which
No.
one?
Which one?
What are you
because
talking about?
Oh,
anode,
no.
the anode electrode is the positive electrode that we have. Oh, okay, yeah, right.
Cation.
Cation, yes, yes.
Yeah,
So
cation. You see, I have my mistakes earlier, right? So mom says be careful.
Yes.
Yeah, cation. They are positively charged. So osmolality is a
Osmolality is defined as the
millimole.
concentration of which flowing. I think it's the millimoles, right? So it's
Yeah,
A.
it's millimoles. Yeah,
Yeah.
kilogram of solvent.
Kilogram. Yes, kilogram.
Yes,
Yes.
yeah.
Okay. That's right. Okay.
Because the per liter is the osmolarity or the molarity. Sorry, the molarity.
Yes.
The liter per liter is molarity.
It's yes. Okay.
Okay.
What is the substance that can yield a hydrogen ion called? I thought it was A, acid.
Yeah. That's it.
D2L say?
Yes,
Yes, says acid.
it says acid. I read
Acid.
it, but I wasn't too sure if it was right.
Mhm.
Yeah.
Next.
Okay, the next one, I put A, sorry, C, ADH,
Yeah, I have my question mark here.
but I'm a little confused too.
Distal convoluted tubule.
I have B.
And I think that's all that I got too,
Increase
guys.
water reabsorption. I think I have a question mark with ADH, antidiuretic hormone.
Yeah,
Yeah,
Question.
I
Question
have
we
a
mark.
put question
question mark
mark.
here.
Yeah. Yeah. Keep going. Yeah. Question mark.
Yeah.
Question mark. Ms. Mumun tomorrow,
Just
please.
expect, right?
Yeah.
Moon is going to give you the exam password and then you'll sleep. No more moon.
Yeah. Yeah. I'm wondering, Miss Momo. Yeah, you can give and where to check it, where tomorrow morning we have the from.
So you guys are
Yeah.
ready for tomorrow morning exam, right?
Yes,
No,
ma'am.
miss.
Yes,
We
No,
have
no.
a question here. We have a question here. What
No, there is
unknown pack?
no
What?
first one. You guys have to do that.
Yeah,
We
okay,
did it,
ma'am.
but we never
Let's
Okay,
got.
continue.
no,
Yeah,
let's
let's
continue.
continue.
Don't use the
Continue.
don't waste the time. Yeah.
Don't waste time. Yeah, continue.
Yes,
Thank you,
sorry.
mom.
Yeah.
Evelyn or somebody wants to take over. That was where I got to. I got to like the 99th
Yeah,
question.
Evelyn. Evelyn.
Yeah, okay.
Evelyn,
So we
okay.
have a question mark
Evelyn.
about the ADH. Okay. Hypernatremia can be caused by which of the following? I have a question mark also here.
Okay.
Because dehydration, diarrhea. I'm not sure. I have a question mark.
Oh yeah.
It's the dehydration for me.
Dehydration?
Yeah.
What about diarrhea?
It can cause dehydration, of course, as well.
Yeah, dehydration also is my answer. I'm back, guys.
Oh hi.
You're back.
Yes,
Oh my,
ma'am.
you're so fast.
Yeah.
That's great.
Yeah. Next one. Which of the following hormones are produced by the kidneys? It's letter D. My answer.
Yes. The last.
Erythropoietin and renin. 46-year-old male with pain in his feet and joints are associated with gout is letter A. Uric acid.
A.
Yes. A.
Expected creatinine clearance for a patient with chronic renal disease would be, my answer is D.
D.
Very low. Renal glomerular filtration is not functioning normally. I'm not sure, eh?
My answer is D also.
I wasn't sure about this one here.
Yeah,
Very
I'm not
low.
sure.
Because there are two key, letter A, which means that renal glomerular filtration is functioning normally. It will not. So,
But I thought that the result is going to be very high, not very low.
I would say creatinine clearance will be because the absorption is no longer good. We will expect a low creatinine clearance. I'm not sure, Yusra.
Yeah.
Let's ask mom later.
Yeah.
Yes.
Yeah. Next one, testing blood from a patient with acute glomerulonephritis is D. Increased creatinine.
Yes.
Yeah.
Yes.
Yes.
That makes sense.
Yeah. Uric acid is the final breakdown of letter C, purine.
Yes.
Urine. Yeah.
Purine.
Yeah. What is the final protein metabolism? It leaves the liver. My answer here is ammonia.
Ammonia.
Yes.
Yeah. The most inborn error of metabolism found in newborns is. I have a question mark here.
I don't have answer in this
It's
one.
either.
For me, it's either A or D.
Yeah, that's my question mark too. Maple syrup or tyrosinemia.
No, I think it's the
Phenylketonuria.
PKU. Yeah.
Oh. Okay, thank you, ma'am.
Which one is it? D?
It's letter D.
Phenylketonuria, letter D.
Yeah.
Thank you.
Next one, what plasma protein is increased in spina bifida? My answer question mark is alpha.
Alpha.
Lipoprotein.
Protein.
Yeah. Alpha.
Yeah.
Alpha.
Yeah.
Yeah.
So these are coming from your basic knowledge when you are doing the anatomy and physiology.
Yes, ma'am. The Benz-Jones proteins are associated with what disease? It's multiple myeloma.
Yes.
Yes.
But it can also be an inflammation.
Yeah.
If I'm not mistaken.
But mainly multiple myeloma.
Multiple myeloma, ma'am. Thank you. So next is which of the following is a protein molecule that catalyzes chemical reactions without itself being destroyed or altered? I have a question mark here also.
Enzyme.
I think it's enzyme.
Enzyme.
I have enzyme.
My answer.
My answer is enzyme.
Yes.
Enzyme.
Enzyme for me.
Yeah, without being destroyed or altered. Next is lipoproteins transport excess cholesterol.
Back to the liver.
I'm not sure about this also. My answer is HDL.
Yes.
That's
D.
my answer too.
D.
What's your answer too?
Yeah.
HDL.
HDL.
Yeah, I will go back. Okay. Following causes lipemic serum is A and B.
Yes.
E.
Yeah,
Increased
A and B.
cholesterol
Cholesterol and triglycerides.
triglycerides.
Yeah. Next is turbidity in the serum is letter C is my answer.
I'm
It
not
could be
sure about
also
this one.
I'm not sure.
cholesterol,
I'm not sure on
I'm
this.
not
also
sure about this one.
albumin. Yeah, me
Yes,
too.
it's C.
Kilomicrons.
I'm not sure about this one.
Yeah,
I
let's
don't know.
ask ma'am.
Yeah.
Mm-mm. Next is heart is primarily composed. I have my one here. I answered cardiac.
It's
Cardiac.
cardiac, yes.
Yes.
Cardiac. Yeah.
Uh, what is the best indicator for an acute myocardial infarction? Letter D, troponin.
Yes.
And, which of the following condition of excessive fat in the feces? Letter D is my answer, but it could also be Crohn's syndrome.
Is
Actually.
Titotaria. The
Yeah, steatorrhea,
Yes, the fatty
fatty
stool.
stool.
fatty stool. Right.
And this one, yeah, we have already the calculation here. An ion gap, including potassium, is my answer letter A,
A.
5.5
5.50.
millimole
Yes,
per
it's A.
liter.
Yes.
Yeah.
A.
So we are sure about the excessive fat in the feces? Yeah, this is correct, steatorrhea, but I think it's also for Crohn's syndrome.
It's A, right? Calculate
D.
the air and gap.
Yeah, letter A.
A, yeah. Yeah, got it. You have to
Yeah.
remember the formula.
Yes.
Remember this formula, guys. Mark it in red.
Yeah, so what are our questions with mom?
Yeah, I want to go back to the carine, whatever. I want to go back to the questions. Keratin. Remember that one?
Clarity? Claritin or
Creatine.
creatinine? Creatine.
Creatine.
Guys, I have a question with regards this one. Who can collect urine samples?
Oh, yes.
Only
Miss said
patient.
patients.
Patients
Only the
and
patient.
Only.
only the patients. Oh,
Yes.
okay. Because I include also the physician because in the D2L they can collect blood and leak body fluids from the patient.
Yeah, she said
So
mainly the
it's
patients, though.
patients. Okay,
Yes.
thanks.
Yeah. So what questions do we have?
The one on page 13 about the expected keratin. Remember that was the last one that we were debating. I'm just looking it up to see what it said. Somebody can do the other R.
Oh, no, page 11.
11? Okay.
Elevated plasma uric acid. Because renal disease was also mentioned earlier, right? Gout, renal disease.
11.
Page 11, major disease states associated with elevated plasma uric acid.
Oh, with the gout, and we had 3 there. Is that one?
Is it gout, catabolism of nucleic acids, and renal disease? Those are my
CD?
answer. The 3.
Those are your answers, Berna. Yeah, I'm not sure about the catabolism, but renal disease, yes, also one. And do you want to ask ma'am about it?
Guys, what is your answer in this part? Which of the following is used to measure the light transmitted by a solution to determine the concentration of the light absorbing substance in the solution? Is it torbidometry? Page 12.
Yeah, C.
Letter
C.
C.
Oh, C.
C.
Light absorbing.
Okay, let's go back to page 11 and try to ask Ms. Mumam about this one.
Yeah.
Light absorbing means it looks as spectrophotometry.
Okay.
No, that one we got, right?
Which
Yeah,
one you are
we
talking?
got that, ma'am.
Yes.
We got
Which
that.
one?
It was, no, since we're on that one, there is a one, same place on 12. There's one below it, the nuclear with both positive and negative charge. We,
Oh,
we have,
Oh,
yes.
that's a sweeter ion. That is from
Sweeter
your
ion.
basic chemistry. That is
Oh,
from your basic chemistry. You
Yeah,
can
sweeter
see
ion
everything
is
can,
my
yeah,
answer.
yeah,
okay,
yeah.
ma'am. Thank you.
It's
so
in the
that's it.
D2L,
So
both
that's it.
positive and
So
negative
it's not
charge.
isoelectric ion.
No,
No.
Yeah,
it's
it's
not.
Yeah. Okay,
okay.
ma'am.
So
Thank
that
you.
one is done. Okay, go back to 11 now, page 11.
Page 11.
Which one was it again?
It's about the major disease states associated with elevated plasma uric acid, ma'am. Select all that apply. Letter A is high triglyceride, B, gout, C, catabolism of nucleic acids, and D, renal disease.
Are you talking
Ma'am.
to me?
Yes, ma'am.
I am
Yes,
working
ma'am.
on your project. Which one?
Elevated plasma uric acid.
What the
So the
page?
selection is high
What is the
triglyceride,
Page
page?
11.
11, ma'am.
major disease
Page
associated.
11.
Page 11.
Major disease
Yes, ma'am.
associated with elevated plasma uric
Yes,
acid?
ma'am. Yes.
Gout.
Only?
I think it's gout. What you guys think? High triglyceride, not for the uric acid. Catabolism in nucleic acid also makes the uric acid. It forms, but it's not the disease.
It's
It
a
says
disease.
what's the disease?
So gout.
Yes.
Catabolism of nucleic acid is not disease, it's the process, right?
Yes.
Renal disease, yeah, maybe the renal disease also, but mainly
Right.
the gout, maybe the renal disease. Make it that way, renal disease, we'll see. It's also part
Renal
of the renal
disease.
disease because it cannot, if that there is need.
Exactly. Yes, ma'am.
Yeah,
So it says, ma'am, select all that apply.
yeah.
So, yeah, I have a question mark on renal disease.
Would it be B, C, and D, or just
No,
B
B
and
and
D?
D.
Okay. Okay.
But
And
yeah, we have another one. We have another one, ma'am, for you. Hormone acts on DCT to increase water reabsorption.
Page number, please.
13, ma'am. Thank you.
Page number
we didn't
13.
finish. We didn't finish 12 either.
Huh?
There's
We
one
still
more
have?
on 12.
Well, I didn't page in page 13 anything. What is the question? What
Page
hormone acts on the distal
this
convoluted tract?
tubule. Yes,
You guys
ma'am.
have to go back to the endocrinology
Yeah.
or in
Water.
the urinary system, ADH.
Oh, thank you.
That's
No,
what
you have to
we.
go back and read it.
That's my answer. ADH, but I'm not too sure.
That's what we. Miss, there's another one at the bottom now. The expected creatine clearance.
Which one is that?
The bottom of 13. The clearance. Remember, we weren't sure of that if it was high or low or normal.
Oh,
Which
must be.
question, Aslan?
Oh,
Oh,
yes.
the expected
Expected
creatinine.
creatine clearance for
Hypernatremia.
patient. Yeah.
The hypernatremia. High sodium.
Page 13.
13.
Yeah.
It's expected creatinine clearance for a patient with chronic renal disease would be.
Page 13.
13, the last part.
Oh, I have the hypernatremia on.
No, it's not hypernatremia.
Oh, page 14.
14.
14, yeah. Yeah, expected creatinine clearance for a patient with chronic renal disease would be.
D.
Yeah, that's my answer to
That's
very.
what I searched in the Google.
Yeah.
Arna goes everything on Google and answer it. Doesn't go to D2L.
No, I did
Google.
also, ma'am. Yeah. But I
Miss,
can find this
sometimes,
one in D2L, so I did in Google.
yes. Miss, sometimes searching in D2L is very hard.
Yeah.
But
So
you know,
D
Google
is
doesn't. Google is okay. You do the D12 and then Google, but
Yeah.
Google
Yes,
doesn't give you all the right answers always.
that's
Yeah,
That's the
true.
yeah.
problem. That's the problem nowadays in the hospital. Patients are coming with simple things, searching in the Googles and this and that. And doctor said,
Yeah.
okay, then ask the Google master to take you to the treatment.
Yeah, exactly,
You
ma'am.
doesn't need you guys. Tell the Google
Yeah.
master.
My
Miss.
mom, if I can
Miss,
find in the
even the
D2L, I'll
doctors are
search in
doing
the
it.
Which one
Google.
is the
Yes.
question?
Page 14, ma'am.
Question?
14.
Yeah, what is the question, dear?
Question is expected creatinine clearance for a patient with chronic renal disease would be letter A, very low. Renal glomerular filtration is functioning normally. B, normal. Renal glomerular filtration is functioning normally. C, very high. Renal glomerular filtration is not functioning normally. And letter D, very low. Renal glomerular filtration is not functioning normally.
Tell me. We just discussed it today.
Yeah.
No.
Well,
Very low renal glomerular filtration
Letter
is not
letter
D.
D.
functioning normally.
Yeah,
Exactly. There will
letter
be
D.
less clearance. Creatine is not going to cleared by the
Yeah.
renal tubes as
Okay.
the filtration is not. So what is going to happen? The
Function.
consequences, your serum creatinine level will be high and low in the urine.
Mm-hmm. Right. So we are correct, ma'am. We
Okay.
are.
Yeah. Mr. Google
Um,
is correct.
same page, ma'am. This one we have not touched. The most inborn error of metabolism found in newborn is.
We all gave the answer already.
You gave the answer D.
Oh,
Yeah.
D,
Yeah,
yes,
the
phenylketonuria.
phenylketonuria.
Right, right, right.
It's
Thank you.
D.
Yeah, we have that.
Page 12. 13
50.
parent is used to access
Okay,
the.
I am leaving now. It's already 2 now. Okay. And not leaving
Okay,
means
ma'am.
no, not leaving means somebody is calling me in the door. They have to come to the.
Okay, Miss. Thank you so
It's
much.
okay,
Thank
Miss. Thank
It's
you.
you.
okay. It's okay.
Thank you,
So
guys.
we are going to do the exam in the morning. You are
Yes,
already
ma'am.
done. You are
Yeah,
already done.
yeah.
Okay.
Yes. Yes,
Yes,
ma'am.
ma'am.
Yes.
So we
Thank
are
you.
going to set the exam at 9:30. Is that okay?
Yes, ma'am.
Yeah,
Because
yes,
some
So
yes.
we
sub
no need to
Okay,
hear.
ma'am.
two are always late. Christian and Sabana. They have to
Oh,
drop their
Miss,
kids.
online I'm good. Online I'm not really late.
Who?
Only today I was late. Usually online I'm not late.
No, but in general, I am telling for everything. So you have to
Yes.
go drop your kids and other things. That's why I'm telling. Other
Yes,
that
okay.
doesn't have to drop their kids. So I'm just keeping. Otherwise, I can start the exam at 9. You want to do me start at 9?
No, please. 9:30.
So you're not late. So we can start at 9. No, I'm just
Yeah.
joking. I'm just joking. I always give everyone time to get settled in front of the computer and make their time, have a nice tea or coffee so that boost up your
Yeah.
energy, glucose. So 9:30 we'll start the exam. Everything is almost done, okay?
Okay.
Yes, ma'am.
Okay, so
Thank
Yep.
study
you.
today. Okay. So not like the review means everybody is answering. You got the Google Master to answer. So now Google is not going to answer for you in the exam, right?
No.
So
Yeah.
yeah, so you have
It's
to
the
keep it in your
D2L.
brain. Yeah, do the study. So tomorrow morning we are going to do the exam. We are going to be on team at 9, but we are going to start the exam at 9:30. It's 1 hour exam probably. I send it in chat, 60 minutes. So 9:30 to 10:30. Then you are going for break. Whoever done before, go for break. Don't write it here. Okay, you don't have to write it here.
Yes, ma'am.
Sorry, I'm done. I'm done.
And the one
Sorry.
that you, ma'am, the one that you have written on chat is the final exam review,
Which one?
clinical
That is the
chemistry
tomorrow's
test.
exam, test 1. 60 minute, 46 questions. That is for
Oh,
tomorrow.
oh, that's
Sorry.
for tomorrow. Okay, ma'am. Thank you.
Sorry, just give me a second.
Okay, Miss. Thank you so much.
Thank you.
And then you doesn't have to write, I'm done. Who's done? You go for break.
Yes.
Some water,
But we are
please.
going to meet at 11. So continue the study for the remaining units, okay?
Okay,
Okay,
ma'am.
Miss.
Okay, ma'am.
Okay.
Okay,
Okay.
Miss.
Miss, drink some
Thank you.
water.
Yeah.
Yeah, yeah.
You guys
Yeah.
complete your review. Sorry. And then you guys can leave, okay? or
Okay.
whatever. Your living time is done. Okay. Okay. See you tomorrow then. Okay.
Yes, thank
Okay,
you.
bye guys. Thank you so
Bye.
much.
Thank you guys for
Thank
staying
you.
too. Thank
Did you
you.
complete your reviews? I am leaving. You are leaving. Did
Yes,
your
ma'am, we're
reviews
done.
complete?
We're
Yeah,
done,
Your
done
review
with
is
miss.
the reviews. We've
complete.
answered all the questions.
Huh?
Yes,
Yeah.
we
All
answered all
questions
the
are done. All
questions.
are done. Okay. Good.
Yes, miss.
Okay. 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 Sorry. I'm too much on you guys. Sorry.
It's okay.
That's
Okay.
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 Drink some water. Take care.
Yeah. Yeah.
Yeah.
Thank you.
Bye.
Okay.
Bye.
Bye. Thank you guys for staying. Thank
Bye.
you
Thank
very
you so
much.
Bye
much,
guys.
guys.
Thank you.
Thank
Bye.
you.
Thank you guys.
Yeah. See you
Thank you.
tomorrow.
See you
Yeah.
tomorrow.
Good luck. Okay, guys.
Good
Get the
luck.
brain hide on till we need it.
Exactly, Louise.
That's right. No, but you're not allowed to use that though.
Right.
Yeah.
Yeah.
Yes,
You
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 See you
too.
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 Good luck for
Bye.
tomorrow.
Good luck.
Yeah.
Thanks. Bye,
Bye.